Pipe up!
What?
Come on, almost!
Nice. Oh! Grenades, explosions, blast injuries, loss of limbs, loss of life. You're gonna get shrapnel injuries, so you have impaled objects into you. You can be amputated, right? So what happens when you get amputated? Your limb is just off somewhere and now you're bleeding out from a major blood vessel. The first thing you think of is compression. Then if that doesn't work, bulky dressing to the area. And if that doesn't work, a tourniquet.
When's a patient woke up?
Oh, cool. This guy's got his ribs open that are fractured or cut open. The doc has his heart in his hand. Look, you can see the branches off the aorta. That's really, really cool. And I don't know if it's pumping or not, but the guy's awake and talking. Where's his anesthesia?
Oh, I lost my medical license. Archimedes! No! It's filthy in there.
Isn't it ironic? It's filthy in there, yet he's wiping his hand on his shirt and then going to put something in his chest.
It withstands this voltage. But I'm fairly certain your heart.
Oh, no, there goes his heart.
Boys, the sound of progress.
Oh, let's see what he's got. A mega baboon. Then we got the Loch Ness hamster.
Where was I?
Holy huge heart. You have branches off the heart itself. So you have major vessels that have come off the aorta. You have your pulmonary vessels as well. And then look at this. You can actually see the coronary vessels around the heart. Like, come on, nerd moment.
Oh, that looks good.
Nice, you got it working. Just
Yeah.
Should I deal with
Then no. But as long as you are, could you hold your ribcage open a bit? I can't see.
Oh! You could see, obviously, you're just shoving the heart in, so it's not going anywhere specific, and you have to reattach all those vessels. When you actually do like open heart surgery, they actually potentially take the heart out and then you work on it while the person is on bypass, which is a machine to actually flow the blood to work on the heart or do a heart transplant, that sort of thing. Oops.
Oh, don't be such a baby.
People break ribs all the time. It sucks. It's painful. You can't put a cast on it. You have to breathe, so it's always moving. It's just pain pills and a breathing actually apparatus called a spirometer to actually help you continue to breathe. That way you don't splint, basically, where you would decrease the volume of air and then increase your risk for getting an infection or pneumonia.
No, they don't.
Oh, he's got this mega machine. Oh, cool. It's like revitalizing the tissue and closing it all up. Bad. I wish I had one of these at my job. Whatever it was, regrew the tissue, put everything back the way that it should. But my question is, why couldn't you just use that for the heart to begin with?
Let's go practice medicine.
Oh, I love it. Nice. I mean, that's how I feel when I walk into the hospital every day. I'm ready to go.
Medic!
Where is this? It was like battling. Oh, cool. All right, so the gun thing basically heals people. That's cool. Nice.
Oh, yeah!
It's almost like the healing power that you get in a game, right? When you get the extra lives or healing power or the medic bag, that sort of thing.
Are you sure this will work?
I have no idea!
Oh, he's flipping it the other way. What is this? Supercharging. Wow. It's like making him invincible. Sweet. Even in real life, right, we have bulletproof things. We typically have bullet resistant apparatuses, but there are some, something can penetrate whatever we're wearing if we are in these situations in the military or fighting, that sort of thing. And you also have to think that the things that we wear on the outside prevent like penetration, but you still have blunt trauma where it can break a rib, it can cause a collapsing of a lung, those sorts of things. But in this situation, like, come on. Just taking them down. good depiction, you got the medics that are kind of behind the front line of this situation. That way they're protected, because I think in the world of like fighting and battling, you aren't supposed to be targeting, even though they probably do, the medics and the medical help on either side, because that's just messed up and wrong to do. But again, it's warfare, so that's still messed up and wrong to do. That was intense. And now we're back into the office.
Yes.
Drinking,
Thanks, Doc.
you know, maybe to dull your senses. If you're in a setting where you don't have an anesthetic, you don't have a pain medication, they did that back in the day. If you're having an operation, you should, you know, be fasted for maybe 6 to 8 hours before, because you're going to be anesthetized and then you're going to be intubated. So you don't want any vomiting risk factors. That's why they say that. At the end of the day, these guys are just getting healed by this weird ray of awesomeness. So have at it, have a drink, I guess.
Oh man, you would not believe how much this hurts. Archimedes?
I wonder what this machine is. Like, what is it doing? Revitalizing tissue, making it heal faster. It almost reminds me of like comic book kind of movies that are out there dealing with like healing powers, like Marvel stuff. I love it. Oh, the lab is exploding.
But it was then.
All right, we got all these weird chemicals falling everywhere. Things shouldn't be easily in this situation where it could fall and break. But things are in glass vials because they don't degrade like plastic would. So the integrity of the medication or the chemical stays.
Inspiration struck.
So now you have chemicals that are mixing together, which is super dangerous. Some people, an example, home cleaners, try to make different cleaners and mix them together, which is a horrible idea. Sometimes you can accidentally make like mustard gas. When you mix chemicals together, the reaction that they have can make fumes, which inhaled could actually be deadly and cause serious bodily harm. So don't do that. You got electricity that's just flying around here. So the concern is, could you get electrocuted? Say it's water. Pure water is actually not a good conductor of electricity. It's the impurities in the water that do that. If you get electrocuted, you need to get evaluated by a doctor, because sometimes if you get electrocuted in one spot, it's going to shoot all the way up and around and you can go out somewhere else. And you got to look at all the damage that can occur. So you can have necrosis, you can have rhabdomyolysis, which needs IV fluids. It can cause kidney damage and kidney failure. If the electrocution is so great, it could stop your heart. So these are things you think about when you see electricity. Oh, what the? That is messed up. Obviously, it's going to take a little bit longer time to actually strangulate somebody. Depending on how much force is hitting the neck, you can cause some spasming into the trachea itself, which then can cause somebody to have trouble breathing right away. Is that wire actually cutting into the tissue? Enough compression to the airway, you're going to cause somebody to stop breathing. In the elevator. Oh no! What? Shoot through the ceiling! That's pretty intense. We're seeing a ton of gunshot wounds and grenades. We always look for entry and exit wounds. The caliber of the bullet, how fast it's going, how close. When you have these wounds, put pressure on them. If they're still bleeding a lot, you can fill the hole with the gauze to get it to try to stop. Then we have shotgun injuries. Those type of blast injuries may cause a little bit more damage to where the person wouldn't actually make it to the hospital. Grenade injury, blast injury, shrapnel injuries. What type of things that pressure of the blast could cause? You're thinking a pneumothorax, so a collapsed lung, ruptured eardrums, because there's air on the other side, so there's different compression changes. So there's a lot of things you have to think about, even though somebody might look fine on the outside. Nice. Walk in. Oh, some stab wounds right to the face, right to the right upper chest. The chest gets punctured by whatever means, causes a pneumothorax. This is when the air escapes out of the lungs, so it actually starts compressing down on the lung itself. So every time you take a deep breath, air escapes and your lungs getting smaller. And you stick a large bore needle in there and let the air rush out. It decompresses that area, but then there's still a defect within the lung tissue itself, so air is just continually leaking out. And if that continues for too long, you pretty much need to have surgery to go fix the hole that's in the lung. Oh, nice. To the face. We don't see too many axe injuries. I've seen a lot of machete injuries. We've seen knife injuries. In the games and movies, you see where everybody wants to hit in the skull. The skull is pretty thick bone. Yes, if you have enough force, obviously you can break through it, but it's not as common as you would think. It's not going that deep. You're not going to actually kill somebody. You're going to stun them. They're going to cause a lot of pain. Then this guy's got a sword and he's stabbing people in the chest. It can go through, but that's why we also have the breastplate, right? The sternum that protects the structures right in the middle. What we see a lot of times actually is the injuries go through or in between the rib spaces and hit the organs on the underside. Oh my gosh. A piece of that head just comes flying off after a shot. We'll see people get shot in the face, front of the skull, and on the backside, the back is blown out. It's more just bloody pieces. You see bone fragments from the skull, brain matter, which is all different types of grayish hue and white color mixed in with a lot of blood. Is that guy on a jetpack? Does this clown remind you of Krusty the Clown? Hey, hey! It's like, get away, get away, get away. Okay, let me just use my handgun. Holy cow, there's so much blood on the floor in this room. A human being has 5 liters of blood, like 8 to 10 pints of blood. Think about that. There's a lot of blood on the ground in this section. Oh my gosh, he killed Agent Smith. Whoa, we got a train. Oh, we got train scenes now. You know, the amount of skill that it probably takes to hold onto a train and shoot with probably your non-dominant hand. You're getting bounced around trying to hold onto a speeding train, but you're actually getting hitting the ground, hitting the wood plankings of the train. You actually could potentially be losing skin in these events. And then say you have to get a skin graft. So you actually take skin from typically your thigh or your butt, or sometimes the back of the arm. Sometimes what they'll end up doing to make that skin stretch out, so to speak, they'll actually put it through almost like a meat grinder. Oh, where'd that train come from? Oh, nice. Okay, at least he gave them a weapon so they can battle each other. Oh, whoa, whoa, whoa. But now this guy just got impaled by a metal post through his neck. If you miss structures, so say you go next to the trachea, you'd actually probably be relatively okay. Outside of soft tissue injuries, it's missing your esophagus, it's missing your trachea, and it's missing the spinal cord and the spine in the back. Millimeters, centimeters, one way or the other can be catastrophic. I love the music. Oh, he's got some powers. Brought him back to life. He's now missing a tooth, I've just noticed. In the ER, we don't remove teeth. We'll replant a tooth if the tooth has totally come out. We can actually use Dermabond, which is medical glue, and the nose piece from a surgical mask. And that's a perfect splint right then and there. Oh, we're back to a massive axe. Oh, cool. I mean, this is how I would play a video game. I just go... Oh my God, get a little hot dog from the food truck. And you gotta eat, you gotta get your protein, get your carbohydrates in. Actually, hot dogs are probably not the best thing for you. Oh, one big massive axe right to the face. Done, clown. Who likes clowns? Nobody. Woo! Whoa, 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 whoa. Now we're on next level, Agent Smith. Look at that move, upside down, single-handed shotgun. The end of the gun is probably really hot, so you're actually going to cause second and third degree burn depending on how long the metal is on somebody's skin. And then using the butt end of the shotgun, impale through somebody's skull. Is it really going to go through the skull? No, but you could potentially cause a skull fracture and obviously laceration. From blunt trauma, the skin just splits and pops right open. And what the heck was that large clown demon white-looking thing going on? No idea what that was. Blew him through a wall. All right, watch your back, bro. Watch your back. Nice. He's got like 6 cents. Whoa. Blade to the neck. Anterior going posterior. So you're going straight through the trachea. Direct line like that. You could potentially hit right into the spinal cord. And then he sliced down. Now, if you get mid-chest, you're slicing right through the aortic arch. You're done. All your blood is just going to be poured out into the mediastinum, out into the chest cavity. What is this massive creature? Got nails in the head. Oof. Knuckle push-ups. Anybody do knuckle push-ups out there? It actually is helpful for some people who actually have wrist injuries. If you can tolerate the discomfort on your knuckles, it's good. Oh, it flies through the air. Oh, got it. Did he literally just punch through him and pull his heart out and now he's dead? Oh my gosh, yes. So cool. Oh my gosh, I love it. Good job, Krinkels. That was nice. I like the anatomy. Good work. Oh, we're getting to the gun cabinet. And of course, there's a massive saw. Yes. Oh, man. You know, actually, I've seen many saw injuries that have come into the ER. It's a chain that just causes destruction, rips through tissue. So hard to put back together. We typically call a general surgeon and plastic surgeon to help out in the emergency department if we can. Get him. Get him. Nice. Cut the face. Oh, everybody's on smoke break. Smoking and drinking on the job, bad idea. Less and less people are smoking, which is really good. I remember back when I was a kid, people can actually smoke in restaurants. You can actually smoke on an airplane. You cannot smoke inside of a hospital. Oh, the guy took a grappling hook to his face. You can actually hook right underneath the mandible. Pretty solid area to grab onto as long as the joints are intact. It's a really sweet joint that actually almost looks like a U, and that way it hinges and moves pretty smoothly and nicely, but there can be some inflammation from people grinding their teeth at night and cause a lot of pain. What? This is a sharp blade. Can you slice somebody's face in half like that? Probably not. A lot of times we'll actually have injuries through the face where it's all soft tissue. Man, okay, we need a little bit more anatomy. So when that skull gets chopped in half, I see light ring of red and dark ring. Maybe we get some gray matter, some white matter in there and see some brain. Ooh, sweet move. Get your sword back, man. Remember how I always say, don't pull it out. If you're impaled by something, leave it in. Take it out when you go to the hospital. Hit somebody with a blade and it's stuck in there. Twisting and rotating it will make the wound bigger, hole bigger, harder for you to stop any bleeding. When we take things out, we want nice, smooth retraction of the object, and then the OR is ready in case they need to go. Oh, jeez. Bad outfit. Get him. Whoa. He's beating people up with his hands only, no arms. You could cause enough trauma to knock somebody out. In Rocky IV, when Ivan Drago hits Creed, what potentially could happen is brain trauma. You can cause different types of fractures of the maxilla, which then compress into the face. It could also cause nasal bone injuries. More likely, it's more bleeding that's occurring with it. I don't know how he's floating. He's got skills. Oh, nice move. So a lot of times we'll see people who have missing tissue for whatever reason. Bitten off, shot off. Where do you get the tissue to put back? You don't. You got to figure it out. There's different techniques that plastic surgeons use to either grow tissue, have nutrients go to a limb. Most of the time you actually have to take it from another site on your body. Plastic surgeons don't just do cosmetic things. They do some pretty amazing things to help people who have major injuries and deformities. Oh, they dodged a bullet. Take that. Keanu Reeves got nothing on you, buddy. You gonna complain about it, Hank? Oh, wow. That would just be brain matter everywhere. It doesn't look like blood. It looks like bubbly red stuff. It's probably the brain matter. Oh, another Krusty the Clown, a different kind. This one's like chompers galore. Look at those teeth. How many teeth do we have as an adult? 32 teeth. A lot of people, they'll get their wisdom teeth removed, and so most people actually have 28 teeth. Oh, what is the caliber of that gun to make such destruction with a simple shot? Whoa! Freaking pizza pie cut out of the face. Holy cow. Just laying on the ground there. Can you just put that back in? Nope. Once that amount of that trauma, you'll be altered for a very short period of time and then you'll be out cold. Whoa, what type of blade is that? It's like a cross between like a machete and a knife. You got the skull flying in air. Never seen these type of injuries before. You're getting into like the midbrain. You're gonna see pons, your medulla. You're gonna see a lot of different colors. What's up with the yellow guys? Those guys remind me of like eggs and like the egg yolk. They must have special powers or something. When people come to the ER, they'll tell us that they have a high tolerance for pain. What goes through a healthcare provider's brain is, do you have a high tolerance? Or are you just telling us that? There's a whole pain medication epidemic where people are addicted to opiates because it does help with pain, but actually hits receptors in our body that actually make us dependent on it. They're good medications, but they get abused very easily. Oh, the yellow guy again. We got a couple yellows. Boom, takes the butt stock to the head. Crushes the skull. There's no recovery from that in this situation. Oh, See how the blade got stuck in whatever that concrete wall would? That's what happens when it goes into bone. Same idea, where it gets stuck. It's not that easy just to rip it back out. Nice. What?
Double whammy.
Bone on the side of the skull is a little bit thinner than the front and the back. It's the same adage of like, can you shoot 3 people at the same time? Same idea with the blade. You're gonna have a little bit less force going to the second person, but you can potentially get it in. You also could potentially go through the ear because there's obviously a hole and a defect there, so you can potentially go all the way through. It's just using like backward technique, shooting. Maybe the hands rotate 360 degrees, which we can't. Ours are limited motions. Oh, sliced body in half. I wish we could see like some good old intestines come flying out of there. Oh. Blunt trauma to the face. It could cause somebody to get knocked out, get a concussion, potentially see stars. A lot of times when people see stars, then the next step is they get tunnel vision and pass out, or in the medical world, we use the word called syncope. Cool. So much force that he got thrown through a wall. You know, we see this in movies, games, TV shows. The wall is going to cause a lot of destruction on the backside. Like, you're going to have some broken bones. These fights go on for so long, the amount of swelling that you're eventually going to have, it's going to start building up in your system, and you won't be able to close the fist as well or as tightly. Oh, there's that backward move. I love it. Ooh. Whoa, using some like magical powers to prevent them from shooting him. Nice. Buried alive. You see in movies all the time where people like get buried alive. There's 2 ways that you actually die in those situations. One, you lack of oxygen, and the other one is actually get crush injuries, and that actually decreases the ability for you to expand your chest and actually breathe. Wait a minute, what outfit we got here? We got like some like bionic arm. What? He just ripped his head off. If you were the mountain, maybe you'd be able to pull that off. I've seen where people potentially rip somebody's trachea if they can break through the tissue in the skin and kind of pull that off. It's really hard to rip the head off because you have all the other connective tissue. Oh, he's still going, but he just took a knife to the side of the head. If it's deep enough, that's going straight into the brain. And if it's going even deeper, you can go into where the spinal cord goes up through the skull. Yes, he's still functioning, no problem. Whoa! A jab to the knife, straight to the face. When you get like injuries to the mid-face right there, they're called Lafort fractures. There's different levels of them. Depends on how much bone is broken and how compressed in it is. Oh, using like, this guy just got booby trapped. Depending on where it's impaled, you're sort of going through intestines, you're going through the stomach. You have a lot of different organs in the abdomen. You could potentially live for a few hours if you don't get off there or don't die right away from some other injury. Like a gunshot to the face. Doesn't that guy with the fake arm remind us of the Mortal Kombat guy, Jax? You know what this actually reminds me of? If you guys ever played the Simpsons arcade game, before you get to the next level, you have to like beat that massive character. Hold on, bro! Get him! Get him! Save your buddy! Nice. I don't know what that electricity was. Look at that gun. I don't even know what type of gun that is. It's got a cartridge full of bullets in there. I can't wait to see what this like, zips. It's just gonna cut people in half. Oh, there it is. Done. I feel like it's almost like cheating. They're just literally cutting people in half. It makes me think of like the last Rambo that was made where he was on the back of a truck with like a big 50 cal. What is this devil? I guess that devil is the one that was like playing with everybody's like strings, so to speak, and giving them like energy and whatnot. Oh, puncture wounds to the head itself. If it goes into the face, probably is okay. You'll end up getting fractured. But if it goes into the brain, through the skull, probably not survivable. Oi, Pretty cool that you can see the bones on the right arm. It's depicted really well, especially at the elbow. You can actually see the ulna and the radius. Gunshot wounds to the head, depending on caliber, distance, and area of the brain hit, could lead to bleeding the brain, traumatic brain injury versus succumbing to the injury. Or getting hit in the head with a morning star. Not something that typically comes to the emergency department. We typically will deal with blunt trauma to the head, metal objects, hammers, rebar, baseball bats. We'll end up getting a CT scan of the head, neck, and face, depending on the areas. Okay, direct trauma to the left eye. You're getting a puncture wound to your globe, the eye itself. We get worried about all the fluid coming out of the eye besides the integrity of the structure of the eye. So the ophthalmologist, which is the eye surgeon, needs to evaluate, is there something that's salvageable? Can you still save the eye? Just watching that hurts my hand. All I can think about is broken bone, broken bone, broken bone. Typically when people punch something super hard, they punch with the wrong parts of their hand and they hit with these two knuckles, and these two bones decide to go and snap and cause a boxer's fracture. Oh! Massive blade right through the side of the head, going through the ear. So you already have part of a hole there. But on the other side is all the structures relating to the hearing apparatus as well as our vestibular apparatus. So having to know where we are in space. So you get really dizzy real quick. I always tell you, don't pull it out. Pull it out and now you're gonna have bleeding, a lot of swelling to this area. Doesn't necessarily mean somebody's dead or going to die, but we'll get somebody to come to the hospital. Emergent imaging, we'll likely have to intubate this individual, have a neurosurgeon take a look at them. Oh, malfunction and self-injury. The worst type of self-injury that we do see is accidental discharge of somebody's own handgun, where it's in the inappropriate position and they shoot their own leg or hip or genitals. Yes, this does happen. Explosions.
Explodes.
Pneumothorax, hemothorax, so lungs can pop open, eardrums might burst, and then you're dealing with the burns thereafter. From an emergency standpoint, burns are pain management control, prevent infection, and then also fluid hydration because you're losing fluids. A lot of destruction happening. We'll see people come in groups to the emergency department. There's something called mass casualty accidents, but we'll just have, big car accident where there's 4 or 5 people come. And that's when you actually really use your triage system. You're triaging individuals of who needs immediate care, who can wait a little bit, and who potentially is going to succumb to the injury. Whoa. Missing the eye. When people actually have one eye, monocular vision, you'll eventually be able to have better depth perception after the body and brain gets used to it. But at the beginning, your depth perception is going to be a little bit off because you do not have binocular vision. Big injury, laceration to the side of the head. That blade is really long, can go right into the brain tissue. And if it hits deep enough and causes enough bleeding, can cause pressure in the brain, causing brain herniation, or just the trauma to the brain tissue itself. Whoa. After watching the chaos that is Skibidi Toilet, my brain could use a chill pill. That's where Chillax can help to bring back those chill vibes. You can grab Chillax at lifehappens.com or on Amazon and get back that balanced feeling. Ouch. Electrocution to the head. The big things that we worry about cardiovascularly, what is happening? You're having so much impulse of electricity to the heart, it can send your heart into ventricular tachycardia, ventricular fibrillation, and cause you to go pulseless. Whoa, just chilling. It fries your nerves, so your function of the nerves don't work anymore. It will also fry your tissue, causing muscle breakdown, rhabdomyolysis, kidney failure, elevated potassium levels. A lot of bad things happening. Head injury down onto the concrete. We see a lot of injuries that way, not being forced this way, but when people fall, they hit their head. Skull fractures, intracranial bleeding, as well as the soft tissue injuries that we need to repair. What? What? Did you all just see that move with the blade to the side of the temple? There was a twist.
Twist it.
Twisting it will cause more damage. Please don't do that to each other. Oh my gosh, the knife's still on the side. That knife could be going through the bottom aspect of the frontal lobe, might be missing it, could have caused eye trauma in the back, hitting the muscles and the optic nerve and going straight through. Whoa. The beams here are just high energy, thus causing destruction of the tissue. Energies like the sun has super high heat, the crematoriums. We typically don't have this type of energy at the hospital. We do use like cautery as heat to help with different wounds. So surgery, they have the Bowie knife. It's a knife, but it also gets heated up so you can actually cauterize things. Ooh. A lot of head injuries because we have heads in the toilet. Most of these injuries that I see relating to head injuries is blunt trauma. We do not see a lot of penetrating trauma outside of gunshot wounds. Most of them are likely fatal and they don't make it to the hospital. Whoa, that reminds me of the mountain from Game of Thrones. It could happen. Not compatible with life, not something that shows up to the emergency department, not something that's even taken by the medical examiner's office. Whoa, oh, we know what's happening here. We get an attempt at good anatomy of cervical spine, the connective tissue, as well as almost bones. So good job for the creators. Oh. Whoa, regeneration here. Actually super cool. I'm just looking at the neck itself. Look at that neck. We're seeing pieces, what it looks like possibly maybe a trachea. That would be really cool versus just bones of the spine in the back.
Guess there is a god.
Oh! What the heck? You're just starting off with somebody just getting shot right through the chest. Sometimes bullets, they're just random. You can get shot once, it kills you. Get shot 20 times and you're fine. It just has to do with location.
With this company, I really wanted to prove that we're capable of doing the same things anyone else can. Like killing people.
What the heck? In the operating room, you can definitely have different types of circular buzzsaws that are super fine to be able to cut bone.
Doctor, he's not responding.
Wait a minute. In trauma, you need to go systematically through a process. Airway, breathing, circulation. When it comes to non-trauma related cardiac arrest, it's maybe cardiac, then airway, breathing.
Oh, what a step!
The blood hanging in the background is showing A positive. Unless the person has A positive blood, you can cause an allergic reaction or a rejection reaction.
It didn't do anything.
Actually, be surprised, the face just swells up pretty bad. Sometimes we'll actually have to do a CT scan of the face to make sure that there's not a collection of pus in there.
Damn it! I'm not losing another one.
Hopefully it doesn't lose that many people. The percentage of survival in cardiac arrest patients is pretty low. The defibrillator pads in his hands, we don't use those anymore here in the United States. We use disposable ones.
Clear!
Oh my God. They're randomly putting all these paddles on this patient. Typically, it's the flank on the left and right upper. And the reason why you do that is you're trying to get a conductive force between those two, and your heart's in the middle.
Holy it actually worked.
Sometimes you do something in the emergency department and you're shocked it worked. Sometimes doing MacGyver things or you're following the algorithms. That's why we always try and we always work hard in the emergency department no matter if we feel that it's futile in certain situations.
He appears to be in stable condition, but he'll need surgery. Now, what insurance provider do you freaks have? His insurance!
Oh my gosh, they're trying to kill him. That is funny. Here in the United States, by law, they have to do at least a medical screening exam. Patients can refuse care if they want, but we have to examine you if you come to the emergency department. It doesn't matter if you have money or not.
Yeah, that's not exactly how it works, ladies. Sorry, your fire doesn't really hurt us.
Yeah, that's kind of what I thought. They're already in hell. They probably like the hotness, and they're dead too, I think. We see burn injuries all the time. The other thing you have to think about is inhalation injuries. It's actually taking the oxygen away from you. So you actually are going to be suffocating probably more than you're going to be burned.
I'll just shoot you in your smart mouth.
That would be more effective.
Blitz!
Whoa. Could you potentially survive that? There's always a possibility, depending on where in the brain you get hit and then how much bleeding and other basic organs that were involved in the shooting. What? These guys are just offing people? Holy cow. You gotta be really careful in situations where you're drinking alcohol, your inhibitions are down, your judgment is down. Somebody says, oh, just follow me. You don't tell somebody where you're going, you can get killed, you can get jumped, you can be taken.
That's 9 kills in the bag.
Could some of these injuries actually kill them? More often than not, you're gonna cause maybe a skull fracture, maybe some bleeding. All these injuries would probably end up in the emergency department and you can get evaluated and probably survive. What the heck? Most of the time when we see like blood squirting, it's an arterial bleed and it's one shot. And then when it happens, you literally can just stick your finger in it to stop the bleeding. My favorite part is that he's hanging on to the uvula of the fish monster, which is like the punching bag that we have in the back of our throats. Sometimes people actually have their uvula removed if they have bad sleep apnea. Wow. When we see dilation, typically you can see that in somebody on speed. So opiates will actually cause your eyes to constrict. We'll actually give Narcan, which is a reversal agent. We see a lot of these like neck type injuries. Most of the major vessels are on the side near your muscles. When you slice those open, you can die pretty fast, but if you can stick your finger on it, get the bleeding to stop, then you actually be okay. But that needs to be sutured back together. Whoa.
Stop looking.
I can't stop. I've never wanted to die more than I do now.
If you get stung by a bee enough, you can actually have an overwhelming reaction that could be almost similar to an allergic reaction. What we call when people actually get fluid and swelling in the tissue, it's called third spacing. It's a new formed space that wasn't there before to where all the fluid ends up going. We actually see a bunch of chainsaw injuries. Basically, people who aren't paying attention, the chainsaw can bounce and you can hit yourself. Most of the time it doesn't go all the way through, but it actually can rip through the tissue. If you're impaled, say it goes right through your artery. The minute you take it out, now you have a hole in it and it's gonna pour out. So if you leave it in until you get to the hospital, then you take it out and you go to the operating room and we can fix it right up.
A wonder of art and music. Something always there to comfort, entertain, and live for.
We see people near their end of their lives, but for some reason, the body is holding on to something. A lot of times what we end up seeing is somebody who's been sick for a week and shows up to the hospital, boom, they just die right then and there. They get to a place where they feel like they're safe and the body totally relaxes and they plummet. Oh no! Depending on how high you drop something, you can kill somebody pretty easily. Same thing as somebody jumps from the same heights. But it all depends. It's a wide variety of injuries that could occur. Whoa. A lot of times people will come in where somebody actually complains that they were strangled. The biggest things we worry about in the emergency department, one, airway, and then two is actually vascular. There's always an issue that you can potentially get a dissection. There are different ways, self-defense. If somebody comes from behind you, a quick one is trying to throw the person off balance by changing your center of gravity and then using different types of leverages, obviously trying to do it sooner than later when you have the most amount of energy. Oh my gosh. If somebody has a stab wound, bring to the emergency department. It could be nothing or it could be something super crazy deep and you need a surgeon to take a look at it. Oh, there we go. I was waiting for it. Anterior laceration to the neck. Major structures right on the side. Your carotid arteries and your internal jugular veins. And then obviously you have your airway in the front. Airway is protected by the cartilage. There is some blood vessels in the front, but the biggest bleeders will be on the sides. Do I ever see somebody who's been decapitated? No, because they don't come to the hospital. We do see people that have what's called an internal decapitation when they get a severe cervical spine injury, usually due to high velocity injuries. Oh, just slicing a body in half, just like Mortal Kombat. Heart is middle central, but then also to the left. But your aorta comes up, goes a little bit to the right, and then down to the left side. Not something I've ever seen come through the emergency department. So all 4 limbs are amputated. That's going to be very hard to salvage, save. You're literally going to have to put somebody in 4 different tourniquets. If you have tourniquets, grab the limbs, take them with you to the hospital. But your first goal basically is to prevent the person from dying from bleeding out. Could you have a 4-limb prosthetics? Yes.
Boss, cover me! Yes, sir!
Some of these individuals are going down with 1 shot, some take a couple, and that is quite common. Depending on where the bullet hits you will depend on what's hit underneath. Sometimes it's soft tissue, sometimes it's 1 shot and you're done. We see a lot of animal bites that come to the emergency department. House pets to strays to random animals. We see people come in, might have thought they got bit by a bat because they're concerned about rabies. Bats typically don't cause pain when they bite, so if there's any inclination that there could have been a bat bite, we will treat for rabies. Explosive injuries, right? We talk about those often. Different type of compressive forces, basically. Body can get shrapnel, lacerations, puncture wounds. It can just be ripped apart. We also see people who get potentially fractured ribs and punctured lungs. Oh, we got a blow dart. We got some sort of dart to the neck. We don't use tranquilizers in the emergency department. We use sedatives. Do we have medications that work that fast? We have meds that work pretty darn fast. Typically will work in 10 to 15 seconds to get somebody to be sedated.
I won't be sedated.
Oh, and somebody gets electrocuted. Cardiac arrhythmias is the bad stuff. And then burning the tissue as well as burning the nerves and having chronic long-term nerve problems if it's a highly sustained injury.
Well, we could play games.
Yeah.
Truth bomb.
It's pathetic.
That was oddly personal.
Yeah, you're right. I don't know why the I just let my guts spill like that.
Oh my gosh, so we got some truth serum, right? Makes me first think of all the truth serums out there.
There's no such thing as truth serum.
The more common one that I've heard names of is sodium pentothal, but we don't use that at the hospital. We don't use truth serums. That's more of a spy world thing.
This is gonna be a good night.
We do have some medications that we use that are gas. Sometimes you go to a dentist and they'll give you nitrous oxide. When you go to the hospital, you have surgery, we'll give you medications to basically knock you out, but they actually use gas to keep you down. Oh! We deal with a lot of burns that come to the hospital. Treatment for burn pretty much is pain management. If it's open, charred tissue, you may need to have a skin graft. You typically will have a graft from your own body part. So like usually your thigh or your buttocks would be a donor site. Why is it burning? It's like water. Oh my gosh. Well, that went from bad to worse. Obviously, you worry about like smoke inhalation, swelling of the airway. I've seen many cases where you see like burned nose hairs, eyebrows, black soot in somebody's mouth. That's a scary indication that the fire got into the airway. Whose trunk of their car looks like that? That dirty.
No one with Eminem's marriage but me.
Oh! Another injection into the neck with some random green goop. Green stuff that we see in the emergency department liquid-wise. Sometimes there's some antibiotics that have like a neon hue to it. Liquid cocaine, yes, I said that correctly. Liquid cocaine is green.
Sorry, babes.
You aren't the only junk in my trunk.
If a wound has green on it, then you're concerned about the specific types of bacteria that are in the wound. Sometimes people's poops are green. Usually that's okay. It's usually related to food dyes. The other thing that we see a lot of that's green is bile. Bile is stored in your gallbladder, helps digest fats. Whoa, a little taser.
Now take care of the others.
We don't see those type of handheld taser injuries. Typically, they're just causing a local issue. What we end up seeing is a lot with the police tasers where they're shot out and there's barbs that are stuck into your skin. Oh, geez, strangulation issue. Mechanism for strangulation injuries are related to the compression of the vessels of the neck as well as the compression of the airway itself. So it's twofold.
Welcome, Bingo. And this must be Tuna.
Luna. Yeah, and you can hurry up, please. She's a fan of shots, so let's try and make this quick for all of our sakes.
He's a doctor. He's a goat. He's got flame from his head.
I see hellhounds every day, and there hasn't been one that has caused any issue.
That is a massive syringe. We don't have syringes that big. If you need to give that much fluid to somebody, you're not going to give it as an IM injection. That's too much fluid. You'd give it in an IV and drip it over a period of time because you don't want any adverse reactions of giving something too fast to somebody. Oh my gosh.
Right there. Told you, dip.
Sometimes, say like with a dog or a cat, you can actually give subcutaneous, so underneath the skin, basically fluid. And you get like a big pocket of fluid there, especially if you can't get an IV, and the body reabsorbs it. You know, we see a lot of humans that end up getting like jaw fractures, teeth that get broken or avulsed out. So if you get an avulsed tooth out, find the tooth, wash it off, typically just rinse it or put it in your mouth, go to the hospital immediately. Oh. Intramuscular injection right into the gluteus maximus.
Maybe just one glute?
We actually do injections that way. If you have syphilis, the treatment is an IM injection of penicillin, which does hurt. So not bad. Helluva Boss, not bad. There were a lot of other things that we were able to talk about, which is good, and it was actually quite entertaining for me. I don't know if it was quite entertaining for you. I hope it was. Also, big new things on the horizon. Check out my brand new supplement company, Life Happens. If you guys definitely enjoyed this, definitely check out this playlist right here. And as always, make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.
Correct your mistake.
Building collapses, large objects falling on somebody. What do? What happens? So you can be compressing the blood vessels of the arm. You're gonna start getting swelling, a lot of pain, a lot of discomfort.
Seriously, you're pathetic, you know that? Ready to die rather than accepting mercy? No.
You'll probably end up getting compartment syndrome in that arm. When somebody gets compartment syndrome, we think about the 6 Ps: pain, paralysis, poikilothermia, which has to do with no temperature regulation, paresthesias, pallor, and pulselessness.
A failure.
Oh, okay.
Okay.
What do you do in that situation? Try to get that bleeding to stop. Direct pressure to the area. That's the first thing you want to do if you can get it to stop that way. Most likely in this type of amputation, it's going to continue to bleed a lot and you're going to use a tourniquet.
You were on the front lines. I wouldn't forget a bad like you. It's why I named you after the best thing ever, Vaggie.
Actually, it's pronounced Vaggie.
Big, massive puncture wound to the body. Hard to tell exactly where that was. Most of the time, we see people come to the emergency department with impaled objects. It's not due to this. It's due to literally accidents, car accidents. I see people trip on fences and get impaled into the soft tissue. Oh, that's what I was gonna ask. Where did the eye trauma? What happened? We got an eyeball coming out. It's attached by your optic nerve, 6 muscles of the eye. So you'd have a lot of other muscles attachments. But we do get a lot of eye traumas. If it's over your cornea, it causes a lot of pain.
Filth like you has no place in heaven.
Cut off the wings as well. Ouch.
Ouch.
Losing an appendage of some sort. Cutting off your arm. Same idea. Could you bleed out and die from this area? Potentially. So you have to make sure you figure out how to stop these wounds.
You ungrateful, disgusting losers.
Whoa, stab through the back. It's got to hit the heart. But you have your whole vertebral column there in the back with ribs protecting us. If you have a blade that's strong enough, then you're saying, okay, I need to rupture either the aorta, one of the heart chambers, to cause somebody to die super fast. Oof. Their blood is yellow or gold. Our blood is red. We all know this, but there is a very rare blood type.
A very rare blood type.
It's called gold blood, and there's only a handful, maybe 50 people in the whole wide world that literally have this blood. What? Obviously, I haven't seen any exploding heads that come to the emergency department, but we do see blast injuries every now and then. Commonly come to the emergency department for ruptured eardrums, sometimes a ruptured lung. There's a lot of compressive force there. In the medical world, we leave the bullets in individuals if they had a gunshot wound. Usually they're deep in certain areas that you can't get to, and you can cause a significant amount of other problems, so they're just left in there.
Eat lead, sucker!
Eat lead, oh my gosh. Have they done some studies before of lead poisoning in individuals where the bullets have been left in? They've tried. They don't really have the good long-term studies, and they don't have a large population of people that they are studying. Is it theoretically bad that you have lead just sitting in your body? Yes, and you probably need to be checked, and you probably need to have it removed if you start getting elevated lead levels. You shoot somebody enough that they explode. No, it doesn't happen that way. The body just continues to be almost like a pin cushion. Bullets go straight through, or they just get lodged in.
I told you, I can handle myself, baby.
Oh, man. People who are specialists in ballistics, they don't like when people refer to like bullets changing trajectory and hitting and bouncing around, but they actually do. Usually has to do with like lower velocity and lower caliber.
Caliber? This did not go as planned.
A lot of times at the hospital, we'll actually put paperclip over top the skin where the entry wound is. So that way when you do an x-ray or CT scan, you can actually know where it entered to figure out, okay, this is where the path should be. Where is the bullet compared to where it went in?
That was something I didn't expect to see.
Like I said, you don't know me. Sex ain't the only thing I'm good at.
Good to know. Because this guy ain't half bad.
The most bullets I've ever seen in a person probably is around 10. The most amount of stab wounds was probably around like 15 to 20 per se. Holy cow, okay, we got massive tentacles coming out. This is an intense clip, getting smashed by the tentacles as well as being impaled. We actually have vertebrae, nothing else there, and only pieces of the vertebrae in the sense of the vertebral bodies. Those are the things that herniate and push and causes issues relating to nerve pain. Character just starts to glow green. Now, I see patients come in that kind of have a hue of green sometimes, but that's usually due to the fact that they're pretty sick, nauseous, been vomiting a bunch.
What a fantastic show.
Skin just changes color in such a way that, say, if somebody's really anemic or decreased blood in their body, somebody who's Caucasian will be very pale. Somebody, say, has olive skin, it'll actually start changing to more of like a yellowish color.
Radio is dead!
What just happened?
Ooh. Whoa.
Yes! You, Alistair!
Massive amount of trauma to the spine, to the ribs, to the back. Could cause so much trauma to the heart, causing what we call blunt force trauma, which could cause things to rupture.
Have to disagree with you there. Radio's not dead, but it is ending this broadcast.
Bye.
He's got so much injury that he actually succumbs and disappears, so I'm assuming maybe dies. But we got blood coming out of the mouth. It is classic. Sometimes it happens. Most of the time in the emergency department when we see blood coming out of somebody's mouth, it's usually from a nosebleed or if they've actually vomited blood. Sometimes we'll get people that cough up blood, but that's not as common.
Is it supposed to be that color?
Oh! Don't wash your hands, you're a robot, idiot. Okay, that's pretty funny. Got signs to the ER. We actually do have to wash our hands in the emergency department. Anytime we see a patient, you should have your hands washed before going in and actually when you leave. Oh, this is funny. Oh, we got an ice pack on the head. So ice is good. Ice helps decrease swelling, obviously, and numbs up the area. But you also have to think when you put ice on something, it decreases blood flow. So in some situations, putting ice on an area might actually slow down the healing process. Whoa, we got wings. Oh, so a little bit of hole directly through your hand. Obviously, these are little robots. The hand, you have lots of specialized muscles, nerves, blood vessels, and bones. A lot of times, we'll see nails, knives. These are kind of the common things that we'd end up seeing put through someone's hand. Wrap it up, put a bandage on it, like compression, right?
Oof, stuck yourself? Just pop it in your mouth. Our saliva neutralizes the nanites. Otherwise, I'd be constantly disassembling myself.
Very cool. We don't have something like that within our own bodies that neutralize things, minus the fact that we have things that we cannot see with our own eyes having to do with antibodies, T cells, and B cells.
And by our saliva, you mean disassembly drone? Right.
Our human saliva, what's in it? Typically, it's what we secrete in our mouth, helps to break down foods, to lubricate things, but there's a lot of bacteria in our mouth as well. And they say that our mouths as humans are even dirtier than dogs.
No, please stop feeding my own eggshells in front of my family.
Anybody out there have ever seen the movie Edward Scissorhands? Like literally that's what it looks like. We don't see that many scissor type injuries. The more common scissor injuries that I do see that come through the emergency department are hairdressers and barbers.
Actually, it's gin rummy. So.
Oh. Literally, robot head, goodbye. We see people who try to stab individuals in the head, and you'll have a laceration to the tissue of your scalp. But a lot of times with the stab wounds, it bounces off people's skull. But the body collapsing, it does that, it loses its muscle tone, so that happens in human beings as well, especially in that situation. Obviously, these type of injuries are not something that we commonly see in the emergency department, but we do see when people pass out, their bodies go limp. Typically, when somebody dies as a human, you don't get an error message, obviously, and the eyes don't necessarily shut on their own because the muscles are not working. A lot of times what we'll end up doing is actually closing the eyelids for that individual.
I'm just letting you know,
Whoa, cut in half? Wow. I know a lot of injuries we see in Mortal Kombat. You can see the vertebrae in the body, the discs in between the vertebrae and the spinal cord, all very cool. Here, because they're robots, you just see melted electronics. What? It's almost like a vampire. Obviously, drinking another human's blood is not good for you. You can develop toxicities relating to what's actually in another person's blood, increased risk of infection. It can also cause nausea and vomiting. Oh my gosh, using a pen as a weapon. Hey, it actually is something that you could potentially use. You gotta be careful. Patients come in and we're worried about getting assaulted. We have to take away anything that's potentially sharp. Oh. Oh, wow, cool. So like a EMP, right?
Electromagnetic pulse.
We do have the defibrillator machine that does send a significant amount of energy and impulse into a human being. Oh, destroyed. Puncture wound through the back into the abdomen. Organs that are kind of closer to the back, you think kidneys. Where your kidneys sit in your back also is different. They're actually off. Whoa. Oh, very cool technology.
Very cool stuff.
We don't have anything really like that in medicine, but we do have telemedicine doctors out there where you can talk to your doctor via a video screen. Oh, he lost a limb, and it is quite proximal. Where the heck are you gonna put a tourniquet, right? You can't. And what would happen is the blood vessel would probably retract even further into that shoulder. Hard to find it to get it to stop. So what you would do, you do bulky dressing. You take your dressings, your gauze, and you just shove it in there.
On second thought, you're way harder than Doll. Run, idiot!
Oh, right through the forearm. We got some rebar, it looks like. So going straight through the wrist, destroying the bone, hitting an artery. Oh my gosh. Or if you just explode like that, then you don't have to worry about pulling out the rebar. These robots are next level. When I want to take my day up another notch to the next level, I grab Level Up, made by my company, Life Happens. If any of you out there want to check it out, let me know in the comments and maybe we can send out some samples. Coughing up blood versus vomiting blood. Very common thing that we see in the emergency department. We do need to decipher the two because one's lungs or upper airway versus esophagus and stomach. More commonly, a lot of blood would actually be coming from somebody's stomach, typically from a stomach ulcer. Whoa, right away. Caught it? What happened? Oh, just think about that. Getting a knife through your own hand and then ripping it out. I mean, that takes a lot of control of your pain receptors because your hands and your feet have so many receptors relating to sensory and pain that would hurt a lot. Bullet wound, injury to the head, bone fragments go flying, brain matter everywhere, a blast injury that close that's penetrating, obviously not compatible with life.
1, 2.
Oh! Gunshot wound, GSW to the head. You can see all the splatter, so it's probably like oil, right? Oil, that is. Does blood do that? Sometimes, depending on what brain tissue got injured, you could potentially still live, obviously with some deficits. It all just depends on the area of the brain. When a human being ends up having very high temperatures, not necessarily due to fevers, but could be due to fevers, you could potentially start hallucinating and get very confused. The goal for us typically is identifying what's causing the elevated temperature. Is it related to an infectious cause versus environmental cause? Typically, how do you get somebody's temperature down? Use antipyretics, that's the fancy medical words for fevers, Tylenol, ibuprofen. Thereafter, you do cooling measures. You can do ice packs to certain areas. We were always taught the axilla, your groin, the neck, those areas where you have access to major vessels.
How about more explory, less watch from window creepy? Working on it.
Interesting that you see that big blade underneath the chin. You have important structures underneath there. Obviously, your throat and your airway. There's a bone that sits right here. It's called your hyoid bone. You obviously have your Adam's apple and your cricoid cartilage, and then all your tracheal rings underneath.
Did I cheat?
Oh, what? Again? Arrow to the head. You always hear me say, don't pull it out. That would be a situation if you're still alive. I would just leave it in place until you get to a medical facility because you don't know what structures were actually hit. Is it literally right next to something that if you try to pull it out, you die in 2 seconds?
Makeup session by now.
Oh.
Rebecca.
So that looks like half the body removed. There are individuals that can live without the lower part of their body, but in an acute traumatic event, they will have all the blood kind of leaking out of the body. You have your inferior vena cava, you have your abdominal aorta, and it's not sustainable.
Who did this to you? Don't remember name.
Very rarely do we actually see people have blood come out of their mouth, especially with these type of injuries.
Super unpopular.
This script deceptive clues, man!
Purple eyes.
These robots struggle to survive by hiding out from the murder drones. Just like sometimes we feel in life where we are stressed out. I have a supplement that I created for that very thing. It's called Chillax. Find Chillax on lifehappens.com or on Amazon and keep your system running smoothly. Oh! Decapitation or the removal of a head is not sustainable with life. People try to reference the guillotine, a single study where somebody had eye blinking after their head was removed from their body. You can still have muscle movements, twitching of the face, eye movements. These are not potentially conscious activities. Oh, jeez. What is happening?
What is happening?
So the wings remind me of like a bat. There are a ton of species of bats. And there's only a few that you worry about where they actually like bite humans. The concern is that they might have rabies. What the heck is that? I need Coyote Peterson to come over here and tell me what type of creature that was. When we get bites like that where somebody comes to the emergency department with puncture wounds, it's really hard to clean. Bacteria gets inoculated into the tissue. Oh, it looks like she gets hit to the side of the head. Those are always the wounds that I worry about a lot because you have a middle meningeal artery over there that can cause an epidural hematoma. People have the blown pupils and people die as well. Oh, puncture wound to the right hand. So your right hand, obviously you have your fingers and your thumb, right? So we call them digits. You have your metacarpals. You have basically all these specialized muscles in between all of them, as well as the blood vessels and nerves that run in between. Let me know in the comments. You guys know what the yellow glowing chemical is. Let me know.
Whoops. Easy there, buddy. Ow. Up we go.
Oh my god, that's so funny. So again, puncture wound to the hand with a very sharp pointed object. Do you pull it out or do you go to the hospital? Typically you just leave it there and go to the hospital. Pulling it out could increase the risk of bleeding, but again, you don't close puncture wounds, you bandage them.
What did I say about antagonizing her?
You always take her side.
That sticking it in your mouth to try to get the bleeding to stop. You know, please don't do that. Your mouth is dirty and could seed bacteria into open wounds. Obviously, if you have a wound, put direct pressure on it to get the bleeding to stop. Then definitely wanted to clean it out. If it's still profusely bleeding, it needs to be evaluated and checked and make sure that a doctor takes a look at that.
Let's reset these memories one more time.
Talking about resetting somebody's memories.
Memory deleted.
We have people who come into the emergency department with Alzheimer's dementia due to changes of the brain, and we call it their amyloid plaques. You can't recall things that were just formed or new memories, but you can still access some old ones.
Son of a... Come on, solver of the absolute fabric. Get a grip.
Trying to use like fine motor skills to pick up these tools in the emergency department. The only time I ever have difficulty with the tools is after I have like a big cup of coffee. Sometimes the hand will shake a little bit, but obviously I know how to use the ability to calm my hand and be able to use the tools because I'm using very small needles.
Intimidating glare.
Whoa, Sin! For an eldritch...
In the emergency department, the only time we use anything electronic like that, we'll do bronchoscopies where you're using camera on a big, long fiber optic device, or we'll use what's called a glide scope, where it's basically a camera on the end of a blade that we stick inside someone's mouth to intubate so we can see it on a camera. Glasses. So really important if you're having trouble with your vision, make sure you get it checked out by an optometrist, and you're having any surgical issues, get it checked out by an ophthalmologist. Oh, there you go. Oh, funny. Trying to use blades. Almost like an Edward Scissorhands. That is a sweet blade. It looks like a 10 blade because it's round and large. Typically in the emergency department, we use something called an 11 blade, sometimes a 15.
Gentle mouths, dude.
Whoa!
Cute. False. Gross. True. Let's just delete your OSs then.
Oh my gosh, it's like, oh my gosh. I think they're gonna do a lobotomy.
A lobotomy is a French man's bottom.
Old school wise, they would do it through the eye socket and just be brutal about it. If you guys want more information about like lobotomies, definitely check out this video, or we'll leave it in the description below. Yeah, those are not performed anymore.
Вот ваш ключ.
Берите меня с вами.
There's an eye patch there. We actually use eye patches in the emergency department. Majority of the time, eye protection, laceration, or an injury to the eye itself. You don't want anybody touching it, so we'll put this protective eye patch on. Typically, they're hard.
Это условие.
What? If you take a gunshot wound to the face, could you survive? What would happen? Of course you have the chance to survive because it could go through the side, it could ricochet, it could go down. It doesn't necessarily mean it's going straight through. Oh, what do we got? This rusty old hatchet. The hatchet's just a smaller type of axe.
You know what a hatchet is, don't you, Bug?
People do use these against each other, unfortunately. Majority of the time, they're pretty blunt. They're not as sharp, but they are still heavy enough they can cause some damage. Laceration, fracture, dislocation, these sorts of things at different joints. Wow.
Signals picked at this one.
Sometimes these literally can get stuck in people's bones.
It's in the bone!
If there's any bone involvement, you always worry about an infection into the bone. Something called osteomyelitis. Treatment of it ends up being antibiotics for a longer period of time.
Of course, some parts are more valuable than others, ain't they? More valuable.
Whoa, hey, cut that thing up and you're gonna get a big creepy worm. An improvement.
Interesting. So cutting the neck, looking for parts. The neck does hold one of our most important parts, your spinal cord. Without your spinal cord, really is not you when it comes to most of the activities that you would do. Moving, organ function, breathing, and your heartbeat.
Ain't our first rodeo.
What? It's never good when you find things in jars, brain, or head in the fridge. At least things are labeled. We use fridges at the hospital to store some of our medications that need to actually be refrigerated. But everything's labeled, has an expiration date. Somebody just going nuts. We got the black stuff just flying everywhere. There are a couple of procedures that I do in the emergency department where there will be a lot of blood. One of them is something called ECMO. Basically put these big tubes into somebody's blood vessels to help get their blood out and put it back in. And we need to do it emergently. So I don't know where they're at, but maybe they're in an operating room. It's pretty dark in there. Most operating rooms are super bright.
Doing great, dude.
Still moving. Yeah, typically that wouldn't happen. We sedate individuals. We will put them to sleep. We will help breathe for them.
Tried something there?
That saw literally looks like the chain to a chainsaw. The saws that are used in medicine are much finer, really sharp, and we don't use them that often. More magnets. Why more magnets? I'm assuming the magnet is deactivating.
Magnets, how do they work?
We actually use magnets on certain patients in the hospital and even in the emergency department. Typically, people who have pacemakers or a different type of defibrillators, the magnet actually puts it in a very specific mode if it's not working or causing issues.
You're a lot like her, I'll say. Except your yellow eyes.
Nothing like some fun pruning shears to cut off a finger of a robot.
Grab some pruners. Let's prune.
Creep.
Oh.
You've got the wrong... Nori, right? Sure thought killing all them folks was
pretty slick. Stab into the hand and then rotate.
Twist it.
I don't advise that, but that is how more damage is done. In a human hand, you have your metacarpals. You can get in between them or right on them, break the bone, and then actually twisting. Typically, the vessels run alongside the bones, so that's how you cause a lot more damage. Oh, I've seen individuals that have had their hands so destroyed, you know, blast injuries, crush injuries relating to working at a big facility or even car accidents. Oh my gosh. A lot of different reasons why the hand can get mangled and destroyed. But if it's so destroyed, at some point it actually just gets amputated to where there's nothing that somebody can do to put all the tissue back together. These robots are definitely on the struggle bus. If you do find yourself kind of feeling the occasional stress out there, I have a supplement that I created for this very thing. It's called Chillax on lifehappens.com or on Amazon, and keep your system running smoothly.
Use your solver!
Ed! Watch it! I don't think I should. I'm sorry, Ed.
If you do have an eye trauma like that, you don't want to actually put pressure on the eye. It's like the one time that you don't want to put pressure if you're concerned that the globe or the eyeball itself has an open hole to it, because then you'll squeeze out all the fluid. Whoa, 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 whoa.
No, there's no escape, even in death.
What? Lost a limb. I just see you go flying in the background. You wouldn't be able to function well, and the pain would be astronomical. Put a tourniquet on it, get to the hospital, bring the limb with you. Obviously, the patient's going to need a lot of pain medication.
I promise it's better on the winning team.
When somebody starts losing a lot of blood, they actually will potentially start losing their blood pressure. So people will come in and want pain medication, but most pain medication actually decreases your blood pressure. You may reduce their drive to keep their blood pressure up, and you can actually really hurt them. Gotta get duped. You gotta get duped.
Oh, how about you bite me?
Oh, they got a lot of oil or black goo in there. So if you lose like 40% of your total blood volume, your likelihood of survival is pretty darn low if you're not able to get any of that back. Oh, right back at you. Super cool. Inside the chest looked like the heart. We do heart transplants, so the heart is able to be outside of the body, but it needs to be placed on a bypass system, meaning the blood is flowing in and out of a machine, acting like your heart as you're having a heart transplant. I like the music. Ooh. Frying butter? Deep frying, it looks like a stick of butter. It's probably not the healthiest thing for you to be doing. Oh, I see. At the hospital. I like how the doctor at least chained up his bike in an unsterile way.
Okay.
Oh, man! What the heck? Surgery for your heart. One, you should be asleep on a ventilator so you don't feel anything. You do need to make an incision down the sternum if you're doing an open heart surgery, typically called a CABG, where you're using new blood vessels, usually harvest from your own body. Then you bypass where it's blocked. What? Come on, that's messed up. You're causing traumatic brain injury just to knock somebody out. That doesn't exist. Jeez Louise. What is he doing? Just shoving his arms and hands right in there.
Oh.
Okay. Of course he did. He doesn't have a heart. Ripping the ribs open. Okay, so you see some sharp edged ribs. You got to be careful not to hurt yourself and lacerate yourself on sharp bone. Okay, I like this. I like this. It's pumping. Okay. Okay. He still needs a heart. He just don't typically have organs just laying around in the refrigerator outside of an operating room. Hearts are typically fresh because you don't want the tissue to die. With that heart, you need to get it from somebody else, and it's couriered, typically on ice, and needs to be put back into somebody else's body fairly fast so then you can get blood flow and repump. I think that's a little bit of a biohazard problem. What is that? Did you go to the butcher? Oh my gosh. It looks like he must have went to the butcher. He got his meat nicely wrapped. And of course, we got a heart that's on a sandwich that he already took a bite out of. Forget it. It's already gone. Heart, I'm just going to continue to eat it. People actually do eat organs. So most of the steaks that we eat is muscle. A heart is actually a muscle. You do have to be careful eating too much of an organ. Our bodies typically can't necessarily handle it so intensely. Small pieces of it you can. What is this? Trash out here. All right. It doesn't even make sense. Doesn't even make sense. I love how the doctor's like super proud. If you have these big massive hearts, you typically don't want to transplant them because they don't function as well. Too big of a heart, too strong of a heart actually doesn't squeeze the blood out as well. Okay, all right. So we got a blind doctor. With a big syringe. Yeah, I don't think anybody wants a doctor that can't see 100% to try to come at you with a needle. Oh, get another try. Oh, don't do that. Don't do that. Oh, what? This is like torture. Don't just keep jabbing, stabbing somebody, right? It needs to be sterilized. And you never actually go in like this. It's a delicate procedure. You go at a very shallow angle because the veins are just underneath the skin. Oh, it's still happening. It's just... and it's bending and breaking. What? There's no way that you can change direction when you're in there. The needle's gonna snap. And now you have a snap needle inside the body. To be able to get those out if it's embedded, you need what's called fluoroscopy, which is a continuous x-ray an interventional radiologist or a surgeon will use to try to find the needle to get it out. Oh, be careful with this axe. Oh no! Oh! Whoa. How'd that not get him? Oh, the foot. With this type of injury, you gotta be careful or worry, so to speak, for one, it's a dirty wound now, so open fracture, laceration. And then the problem is, can he actually get out of this situation? Okay. All right. That stinks. That was a good idea to think about using the axe to break the piece of wood. But then wouldn't you think that if you broke that piece of wood that the tree's now gonna collapse on top of you anyway? Okay. All right, what's in the pocket? Oh, I told you! Ah! This is... Oh my gosh, I can't imagine the pain. Oh my gosh. Okay, it's a cartoon, but think about this in real life. So you're using a spoon to cut through your leg. Like, that takes a lot of force. Now you have all the tissue is gone in the area. Now you only have bone. And obviously the spoon is not working. So he's getting to a rock to see if he can break it. Oh, that's not gonna work. Just smash it with the rock. Oh, it's split down the middle. Oh my gosh. Splintered the bone with the spoon. Can this actually happen? I think you'd actually have a better chance of just actually smashing it with a rock potentially, or me causing a little bit of damage with the spoon to cause a break in the bone itself to then be able to snap it open. Let's go. I hope he did the right leg. And he chopped off his wrong leg. All right, got the EKG going. Got some infusion. Looks like these are blood infusions. Oh! Darn darn it. Actually, in real life, it needs to be verified by 2 people before giving it, as well as making sure it's the right person, making sure it's the right blood type. That way you don't have errors. We need to double check ourselves. And obviously, you need to take a lot more care in trying to what we call spike the bag, so you just don't waste blood like that. Oh, okay. Went into like VTAC real quick, maybe VFib, and now it was in asystole. Immediately when somebody goes into asystole, the monitor goes flatline. The first thing you do is check the patient. So you want to check to see, is it an error in the machine? So did a cord come off? Is the machine broken? Is the patient actually still talking and alive? If not, immediately call for help, start CPR. Creature didn't do that and looks like just stabbing emergently into their own arm. Let's see what happens. Ah, there we go. Woohoo! I love it. Now, the creature here decided to stab their own vein in hopes of siphoning their blood directly into the person. We see this in TV shows, movies, cartoons, all different things. I've never seen this in my practice of medicine in the hospital. But I've actually never been in the field in the sense of like warfare. You can't just give somebody your blood unless you're compatible. This could work in very rare situations. I've just never seen this occur. Oh, geez. Oh, I hate when that happens. What the? Oh! What? If that actually does happen, right? The major blood vessel that's coming down is your aorta in the abdomen. And if that just gets opened up, you can't stop it from bleeding. You're just gonna bleed out in a couple of seconds and you're gonna die. Then, of course, you have your spinal cord that's severed. The bottom half of your body is gone. No, wait a minute. Nice. That's so disturbing. Holy cow. Okay, this is disturbing as you could get. It looks like a piece of ham. Could this be survivable? I guess if you're able to stop the bleeding, you're able to survive a little bit longer, obviously. But then the question is, what organs are injured and is it compatible with life? I'm assuming he's blind too, so he doesn't always, I don't understand. Is he blind or driving blind? Oh. How many times has somebody done that? Just leaking out. Now you got a trail of blood. You have a trail of fire. Oh my gosh, come on. It doesn't work that way. Impaled into the abdomen, come on. There would be a lot more fire extinguisher injuries than you've ever heard of, but typically you don't, and it's spraying a powdered mist that's a fire retardant to get it to stop. Oh, and the car explodes. That's messed up. You see the explosion, it takes apart the abdomen, and now you have intestines that are just rolling around. And so the intestines look like this like tube, but it's attached by all this mesentery. So it actually is still in a big formed ball when it's in your abdomen. It kind of comes out like a little bit of a fan versus just these like strings. Oh. Oh. That's just mean. What the heck is that? You don't do it with a full cup of hot coffee. Now the animal has like either a first, second, third, or even 4th degree burn. So we don't know what degree of burn. So 1st degree burn, it's like a sunburn. It's just a superficial layer, it turns red. 2nd degree burn, there's 2 different types. There's a superficial versus deep, but that's when you get the blistering. Then you have 3rd degree burn, which basically burns through the capillaries and the nerves, which will then end up meaning a skin graft. And then if it's 4th degree burn, it's going all the way down into the subcutaneous tissue, fat, and muscles. Pretty bad situation. Oh. Whoa! Oh, nice. Oh, man, bleeding out of the ears. So you can have a rupture of your TM, or your tympanic membrane, or what we call the eardrum. You might not have good hearing as well after. Sometimes you can have a perforated eardrum and it's fine and it heals up well on its own. Other times you need a tympanoplasty, where you actually get a new eardrum from yourself, actually. You can use a piece of fascia and then put it right on there. Oh my gosh. Oh, come on. When you're using the otoscope, it shines light into the ear canal, the external auditory ear canal. So that way you can see the tympanic membrane and see if the canal is swollen. That's pretty much all you're going to see. You want to make sure that there's something called the cone of light, which is a reflection of light off the tympanic membrane to make sure it's intact. Oh, tuning forks. Nice. All right, I could hear. When I was in medical school and in training, we used tuning forks. We don't typically use them too much anymore, but the point of a tuning fork is to hear if there's bone conduction loss versus neurosensory loss, having to do with you tap it, you hear the noise, and then you can actually put it on the bone to see if you're having conduction. Ah, you can hear better. Nice. It has just a larger diameter so you can take in more of the noise, so you can pretty much try to amplify it. Now you have hearing aids that can amplify your noise, and then even then, some people who have no hearing, you can get cochlear implants. If you've ever seen somebody with like an electronic device attached to their head, and they can help them hear. I love this candy squirrel. Oh. 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 Oh, man. I thought it was a broken tooth, but it is a fractured jaw. That's crazy. Typically, the only times I see a fractured jaw is trauma from like getting punched in the face or car accidents. And usually you're broken in two places because the energy goes in one place and it needs to go out the other. And sometimes, of course, you get dental injuries as well. Or sometimes we get avulsions where the tooth is gone. Remember, if your tooth falls out and it's an adult tooth, two things that you can do is either put it in a glass of milk or just put it back in your own mouth. And typically we can just shove it right back in there, and then we'll do a dental splint and then get you off to the dentist to make sure that it stays more permanently. Ooh. Oh, yeah. Pliers. Whew. Yep. So why the heck do we wire a mouth shut? It's like a splint or a cast for a broken bone. You want it to set in one spot and not be able to move it in different directions. And then they actually give you a set of pliers so you can actually break through it if you get sick or you need to vomit, because you won't be able to get the vomit out. Oh, people hate it. Yeah, look at trying to use a screwdriver to open. Oh my gosh. This squirrel has a horrible sugar addiction. So sugar is a type of carbohydrate, right? Simple carbohydrate. And our bodies crave it. So if you have it, you're never satisfied. You always want more and you want more and you want more. Oh, oh no! A tongue laceration. Actually, amputation. Holy cow. If you have an injury to your tongue where it's bleeding, it bleeds so much, profusely, hard to control the bleeding, and it's just like all coming out. Yep. It's like a helmet. Oh my gosh. With the lock. That's horrible. I've never seen one of these. We have this thing called the halo, which gets screwed into the skull for somebody who has a cervical fracture. I've never seen this device for a jaw fracture. Oh. What the? It happens. Oh my gosh. What the? Your eye has multiple muscles and then it's connected in the back by your optic nerve. So it's probably the optic nerve that we see hanging out here. But the skin is gone. You don't see any of that. The nose is gone. Holy cow. What is going on? The intestines are very stretchy, right? So the intestines are actually made of muscle and muscle stretches. So it wouldn't rip typically. It could at some point, it's going to rip with enough force. It also potentially wouldn't necessarily strangle you per se because it's so stretchy, but if you have enough force, it's going to do that. This is ridiculous and scary. Oh my gosh. Hiding inside the sleeping bag and now threw it in the fire? This is a horrible scene. Normally the steering wheel would not do that. It would typically actually could bend. A lot of times people will get spidering of the windshield if their head hits the windshield. What the? Bottom half of his body falls off, rips out. That doesn't happen. But the anatomy looks so good. What we see hanging at the end of the clip is the stomach. That's the shape of the stomach. And it's most likely attached to the esophagus still. The esophagus attaches to your stomach. And then from the stomach, it attaches to your small intestine. Basically, the first part of your small intestines is your duodenum. Okay, we all know this is not realistic, but could you actually survive your duodenum being separated from your stomach? Yes, if you have a surgeon that can put it back together. Depending on the accident, a trauma surgeon would need to see versus a general surgeon versus both being in there. Typically, a trauma surgeon is also a general surgeon as well. You already got bandages on the hands from some other injury. I like that they're totally taped up. So you got to go like old school granny style, like the bowl. Oh, I love it. Gonna cause a little bit of head trauma, concussion, that sort of thing. Plus or minus a CT scan, or you're just gonna have to be watched by your family to make sure that there's no change in behavior, nausea, vomiting, or being altered. I love bowling. I love it. At least they're having a lot of fun. Oh, no! That is awesome. The creativity is ridiculous. Man, I didn't know they were so destructive. That's crazy. Oh, the other one! What's gonna happen? What's he doing? Whoa. The question is, will the parts be back in the way that they should, or will it be a mix? Uh-oh. I knew it! Look at the proud dog. Uh-oh, got a problem. Yep. Not so good. Oh, nice. Pull the steri strip and, oh, it's not a steri strip. So there you go. So the bird pulled on suture material. Typically that doesn't happen. That is a continuous running stitch that the moose did. Your sutures should be tied well. You knot it up, so it shouldn't just like come right apart. And the fact that all the organs just went everywhere, ridiculous. Oh no, we know where this is going. Okay, slicing the line. A nail. Busted nail. Oh man, come on. You're gonna have maxillary injuries. The nose is gone, right? The first part of the nose is cartilage. Soft tissue is gone at least. Teeth are gone. The mandible is probably fractured. What the? Oh, and then you put some lemons right into the, that's gonna burn if it doesn't already hurt already. Oh, it stings. At least maybe, is it getting clean? Probably not. Probably dirty because bacteria in somebody else's mouth. Now the question is, if you can find the piece, if it's all whole, it might have enough vasculature in that tissue that you can just put it back on and it actually might take. Oh my gosh. Go to the hospital. There goes your finger. Oh, not again.
Huh?
Oh man, right to the side of the head. Gotta be careful. The side of your head has something called the middle meningeal artery on the other side of the skull next to your brain. That could bleed and that can cause a bad epidural hematoma, and then you get a lucid interval and then you could potentially die. Gotta be really, really careful. The eyeball doesn't fall out like that normally, okay? The eyeball is attached by 6 muscles plus your optic nerve. It's not moving. Oh, nice. Gonna slice the eyeball right open. Oh, gross. I love the depiction. It doesn't look like that at all. The eye is super highly specialized tissue and it's mostly liquid. There's the vitreous and the aqueous. It's all fluid, but it keeps the structure of the eye, that sort of thing. Depiction looks like a piece of fruit. The eyeball doesn't look like that. Oh my gosh, come on. You got bloody lemonade. It's so gross. Please don't drink that. Please don't drink that. Please don't drink that. Oh, gross. Blood does not taste good. If you've had a bloody nose or anything like that, it's like metallic-y, gross. That's gonna make you vomit. It's like noxious to your body. Ugh. Oh, look at it. It looks like a little pineapple wedge. Disgusting. All right, where are we at? Washing the hands. Okay, we got good hygiene. No gloves. Okay. Just get a new box, man. Just get a new box. Oh, that's disgusting. So that's supposed to be like a biohazard symbol, like things that are soaked in bodily fluids. Yeah, bad. Careful, you'll stab yourself. Oh, there's organs now too. Oh my gosh. Happy, dirty, disgusting glove. Wash it, man. Dude, I don't know what you're doing. Oh, you're going to the eye. Oh my gosh. Oh my gosh. A lot of times people actually come into the ER with either like a broken contact lens or they can't find it. Nice thing, we can stain the eye itself so we can actually see the contact a lot easier. 360 degrees, right? And it can kind of sneak in the back a little bit. And we can just take them out pretty easily. Perfect, you got a good contact in, nice. You gotta really be careful of like corneal abrasions, that sort of thing. Corneal ulcers hurt like hell. Usually it's treated with pain medications and topical ointments and they feel much better. And yes, we always wear brand new clean gloves. Oh, nice. Full body decimation. So there are people that go around the hospital try to cheer people up. There's a hospital I used to work at, had the best, coolest Bernese mountain dog that would just roam around, was super loving, and always make people feel better. It's awesome that this hospital is trying to make people feel better with maybe a mime. Definitely a mime. Oh no. Oh, it's stuck in the fan? What is happening? Oh! Oh man, snapped a bone in the leg. That's awful. I mean, what's the bandages for if it's not keeping things in place? Oh no, oh no. Oh. Alcohol. So I'm assuming that's alcohol. Alcohol burns. You're trying to clean the wound. Hydrogen peroxide doesn't burn the wound and it actually helps break down like blood clots. It's good for cleaning the wound in the first 24 hours. After that, because it cleans good cells and bad cells, it inhibits wound healing. You gotta stabilize it. There you go, put it back together. Woo! Call the doctor, put a splint on it. Oh, it's cut it. Cut it, it's just come right off. Oh my gosh! It's like a deer in headlights. Like, what are you doing, mime? Like, stop the machine, like, help. I've seen a lot of injuries, not like fan injuries, but like saw injuries where people's limbs are like sliced off. Never like this. This is like sliced off in sections, almost like a CAT scan machine. Look like every centimeter, a piece is being sliced off, and now we're having like these wheels of tissue everywhere. What the? Yep, a little PTSD. Whoa. What? You're getting a slice through the neck. You're having major blood vessels in the neck. You have your internal and external carotid arteries are still in your neck. You have your jugular veins. It bleeds a lot if you miss or if you poke holes in it. You're slicing it open. You're gonna die pretty fast, especially if you're going both sides. Now, could you take a knife and slice through the bone? Unless you're Rambo, probably not. Oh, he's got a, oh my gosh. Oh my gosh. Let's just throw a grenade inside and the body explodes and he is parachuting down. Maybe free falling. Hopefully he's got a parachute. Oh, he's going from plane to plane. What? He just grabbed the propeller with his bare hands? Yeah, unlikely. He's gonna slice his own hands off. Come on, and then the strength to rip it off. The thing's flying through the air. It's gotta have the structure to stay on to withstand a lot of wind and a lot of force. So it's just not being ripped off by some crazed psychopath over here. Oh my gosh, this guy is like mass destruction. We'll take a pause for a second. The eyeballs came out, but they're still attached because they're attached by all the muscles and the nerve. Very good job. Oh, so cool. That was awesome. Now you just have the skin, which the skin is the largest organ of our body, is still stuck on the airplane. Look at this person. Oh, he does have a parachute. See? Safe landing. That is crazy. Oh my gosh, like alter ego. Oh, it's like an amusement ride and he just went nuts.
Hey, you know skin cancer runs in our family, right? You need to go get yourself checked out and make sure you don't have melanoma or some. So there I am in the reception area for this dermatologist. Hi.
You have a family history of skin cancer. It is good to get checked out, see a dermatologist. If you are at increased risk for whatever reason, make sure that you cover yourself with sunscreen or sunblock, and then also wear protective clothing. Make sure that you're safe as well.
But trust me, on the sunscreen.
I'm here to see if I'm dying or not. Before we tell you that, you need to fill out all this paperwork. Adenoma. I mean, I tried to Google it, but even Google is like, did you mean mahogany?
A lot of medical words are really, really hard. They all have roots in all different languages. When I went to medical school, we were taught that a disease was one name and now it's changing to something different. So it's always evolving.
Finally, they called me in the doctor's office. There's a bottle of lube on top of it. What the hell does a dermatologist need a bottle of lube for? What brings you in today? My dad said I need to see if I have melanoma or some.
I remember when I was a medical student and I did a rotation for a month at a dermatologist's office. You have to look at people naked all day long. It's to try to catch something before it gets bad. So it makes sense. It's just a little awkward.
Why don't you go ahead and take your shirt off for me? So per the doctor's request, I take my shirt off so he can oogle me. And at this point, the atmosphere in the room has taken a very unfortunate sexual turn.
Oh my gosh, this is the mind of a patient. It's kind of funny. There's no gown. What's this person in a gown? Probably cold in the office.
Hey, how long have you had this mole here on your back? What are you talking about? Here, give me your phone. I'll take a picture of it. Now I really look like an idiot. Boy, you were way off. You put an H in there.
So important. You know how many times I tell patients to take photos so you can actually tell if something's getting better or worse? And it's good to be able to follow your own moles.
I have a mole?
Here, you see that? I mean, it's probably nothing, but we should probably have that mole removed.
At least they're talking on the same level. We don't curse in front of patients. We get patients that yell at us and curse at us, but we don't reciprocate that.
I just numb the area and I cut it out. So now there I am, no shirt on.
You numb up the area, a couple injections, and then use a specific type of knife. It's not this huge meat cleaver that the doctor has.
All right, we're gonna send a skin sample to the lab and get it analyzed. If it's bad news, we'll give you a call. And if it's good news, well, we don't really give a so we're not gonna call you at all.
Same thing happens. We'll call you if it's positive. We won't call you if it's negative. You send it off to the lab. A pathologist takes a look at it and see that there's any abnormalities of the cells.
Hey, it's me, your doctor. Bad news. You got butthole cancer. You need to come down here so I can shove a camera up your A camera up my Oh, god damn it. That's what the lube was for.
Oh my gosh. Cancer from melanoma? No. And then why would a dermatologist be doing a colonoscopy?
And lo and behold, a miracle does happen. Everything goes black. I fall over like a sack of potatoes and I start foaming at the mouth like a wild animal. I'm having what some people would call a seizure.
People actually come into the emergency department for whatever reason, where they're actually fake seizures. It's really, really hard to mimic a true seizure. If you need help, just ask for it. Don't try to do the fake seizures.
And I didn't even get to have one of the fun seizures. You know, where you're flopping around like a fish. No, I just laid there, half dead, eyes wide open. What a ripoff.
There are lots of different types of seizures. You can have an absence seizure. You're just nothing's happening, which is what he is probably describing.
Now, I don't remember any of this because my brain doesn't work anymore, apparently.
The brain is working, it's just misfiring a little bit.
Paramedics bust through the door. You know I can walk, right? I have legs that work. Yeah, but you don't have a brain that works, apparently.
It's really funny. Sometimes you can actually have some paralysis after seizures, which will eventually go away, but it does happen.
So we're at the hospital trying to figure out why my brain suddenly turned into a bowl of mashed potatoes.
X-rays of the head are pretty much useless in a seizure unless you're really worried about a skull fracture, but typically you wouldn't get an X-ray, you'd get a CT scan of the head to make sure that there's no hemorrhage inside of the skull.
I know exactly what happened. The thought of me losing to Steven's stupid little brother was so abstract to my brain that it tried to explode itself.
The only time your brain can really explode is penetrating trauma to the head, bullets, explosions.
I have to have an MRI done where they slide you into this big tube so they can take pictures of your broken brain.
Oh, good job. That is a good picture of what an MRI cross-section looks like. Nobody likes to be in it. The MRI is a long tube and it makes a lot of noise and you have to be in there for a long period of time and you can't move.
EEG test.
There you go. Okay, good, good. EEG test basically is looking at brain waves to see if there's any abnormalities.
They glue a bunch of electrodes to your head and they sit you in front of a strobe light. I remember thinking a strobe light, oh my god, they're trying to make me have a seizure now. What a bunch of holes.
They don't glue them to your head. It's a cap that they put on your head. I've never seen any strobe lights when they've actually done this to admitted patients.
Okay, just sit back and relax. We're just gonna shine a few lights in your eyeballs.
Most of the time, people get seizures from either not taking their seizure medications, stress, lack of sleep, alcohol, different things that would actually just stress the body.
Oh man, I thought you'd be flopping all over the floor by now. Well, I guess we could hit you in the head with this frying pan and see what happens.
I love it. If you find that you have somebody having a seizure, grab a shirt, a sweatshirt, a pillow, something, put it under their head, lay them on their side. Don't try to stop their shaking. Make sure you call 911.
My doctor concludes that he doesn't really know why I had a seizure. Sometimes your brain's just stupid, I guess. I don't know. What do I look like, a doctor?
That is probably the more common answer. Our job in the emergency department is to rule out major life-threatening causes for a seizure and to help prevent one from happening again or get you to a neurologist.
Our kid keeps running into walls. He just can't see anything. Why doesn't he have glasses yet? I was like, shut your mouth, old man. I don't want any of these goddamn glasses.
The optometrist is the eye doctor for glasses and simple things. The ophthalmologist is the eye surgeon.
When they test our vision in school, I would just wait and have a bunch of kids go ahead of me and just memorize what they would say when they'd read off the chart.
Oh, that's pretty good. There's a specific distance that you need to be away depending on the size of the chart. And then if you actually can't read, sometimes they actually have the availability to do different shapes.
EZYXWVUT. Boom. You can all suck it. I can see just fine. The chart's over there.
The letters are actually standardized, so you could memorize it, but they'll make you say it backwards or skip around.
So I go to the eye doctor, and if you've never been to the eye doctor before, then you don't know what hell on earth is.
So yeah, optometrists, they actually go to very specific optometry school. They don't actually go to medical school.
One of the first tests they put you through is for glaucoma.
Glaucoma, which is increased eye pressures. It actually can hasten your eyesight loss.
Put your chin up on this machine here, and we're gonna shoot a little puff of air into your eyeball.
Oh, it's so uncomfortable. Oh my gosh. No, it's a little puff of air. In the emergency department, we have something called a tono pen. We numb up the eye and we just gently touch it. We can get pressures of the eye that way.
Now, you usually donate blood for one of two reasons. Either A, you do it for a good cause, like you're supposed to, or B, you're sick of the Red Cross calling you every second, every goddamn day, harassing you like some psycho ex-girlfriend.
There's always shortage of blood. I'm AB positive. If I donate blood, the only people that can actually use my blood is somebody who is AB positive. But I'm also the universal acceptor. I can get blood from anybody. I can get from O's, A's, and B's.
And the first thing they do is have a lady test your blood. See how much hepatitis you got going on in your body.
Yes, you definitely are screening it for all the major viruses and blood disorders.
I look over and see this girl next to me getting her blood drawn.
My God,
She's not looking so good. She's laying down, white as a ghost, looking like E.T. when he was about to die.
We get a lot of times where people give blood and they pass out. I always tell them this is the perfect place to pass out. This is where you want to be. We'll take care of you.
Now remember, your next appointment's in 54 days and 12 hours. You better be there or we're going to come to your house and slash your tires.
Oh my gosh. No, you don't have to go that often, but if you can, donate when you can.
Getting the flu sucks. Nobody wants to be hovering over a toilet all day like you're some kind of Olsen twin.
Oh, man. Flu-like symptoms can actually just be caused by any virus per se, because your body is just trying to defend itself, and those are the symptoms that you actually end up getting. You can get vomiting with the flu.
I had a bad case of the poops. Like, what the did you just say? Why'd you come to work then, huh? Well, I thought I'd come in and breathe on everybody. Maybe lick all the doorknobs in this place.
Oh, this is exactly how, every virus is spread. You're spraying particles around, you're passing germs around.
Then I'll come home and I'm still feeling like shit, but I lie to myself, nah, I'm not getting sick. I ate some pizza rolls 4 days ago. That's probably what it was. It's probably the pizza rolls.
Flu typically is a respiratory illness relating to cough, runny nose, sore throat, shortness of breath. Versus gastrointestinal virus, you're going to have nausea, vomiting, diarrhea more predominantly.
Hours go by, I'm still sitting there. I'm taking meals on the toilet, which is gross, I know. You're not supposed to eat while you're pooping.
That's so true. But every time you have a meal, it's going to mess with whatever's going on. It's going to just kick it out of your system. The fact that he can actually get food in and he's not vomiting it back up is very good. If their stomach is agitated and sensitive, hydration, hydration, hydration. Try to stick with liquids.
The last time I threw up from the flu was when I was 9 years old, and I puked all over my Sega Genesis controller.
Oh no, remember Sega Genesis? Vomiting and having diarrhea at the same time. It's the worst. It actually is quite common. Basically, you have so much force and you have so much intra-abdominal pressure that you just can't control everything.
And every time you throw up, you remember exactly what you ate before you did it. And it's always some stupid combination of food. And on that faithful night, I had the nutritious meal of Fritos and gummy bears.
Oh man, I love Fritos and I love gummy bears. I think both of those they tried to make like sugar-free or healthy for you, which then made people like poop their pants.
Teacher would always make us go up in front of the class and do presentations. My presentation is called Alcohol Ruins Your Life. My sources are this book, A Fifth of Scotch a Day Keeps Your Family Away.
Oh my gosh! The vas deferens is a piece of anatomy related to the male reproductive system. And the fact that we have John Daly has had a history of alcohol trouble. He's a PGA golf professional.
All right, I want everybody to pick your favorite sexually transmitted disease.
Syphilis is a painless ulcer that could, if it goes untreated, actually cause neurosyphilis and get into your brain. Hepatitis is inflammation of your liver. B and C are bloodborne, and the others are basically foodborne or bad water. You got AIDS, which is caused by the virus HIV. You got scabies, which is bugs under the skin, which causes itching. And then we have herpes, which is another virus that could be herpes 1 or herpes 2, but there's other viruses that are also herpes. There's like all the way up to herpes 8.
Ever since I was a kid, I'd get random nosebleeds. Didn't matter where I was at the time, in the middle of class, on an airplane, taking a shit at my grandpa's house, you name it.
If you get a nosebleed, the first thing that you should do is pinch your nostrils, lean forward.
It would just happen randomly. I'd have no control over it. And if I was at home, it was no big deal. You just fashion yourself a little nose tampon out of toilet paper and you go about your day.
Yes, you can stick tissue paper, something to kind of almost block it, but you're trying to actually help form a clot.
What the fuck do you do when you get a nosebleed at a public pool? Panic. That's what you do. Everybody's rushing out of the pool like the water's on fire. I climb out of the side all lightheaded and somebody kill me. I need a fucking blood transfusion. I'm O positive.
O positive, basically he's gonna need either O positive or O negative blood, but he doesn't need a blood transfusion.
And this dude comes out of the middle of nowhere and smashes like 50 napkins in my face. What happened? You get shot in the face? I think somebody shot him in the face. Do you have AIDS?
If you have too much tissue in the way, all you're doing is using it more to soak up the blood versus actually causing it to stop bleeding. And then yes, you always have to worry about blood infections that, you know, could be transmitted to somebody else.
A few weeks ago, every time I woke up, my mouth just killed me. It drove me crazy. Okay, let's get some x-rays. They throw this heavy vest.
A lot of people actually come to the emergency department for dental pain, which is fine because sometimes you can't get into the dentist. Or if there's any suspicion that you have a dental abscess or a dental infection, most of the time dentists won't see you or won't treat you because there's always a concern that if they mess with the tooth, they can reseed the infection into your blood and cause things to go worse.
What the hell is this for? And she's like, oh, it's to protect your body from the x-ray. So I'm sitting there looking like I'm in a Jason Statham movie with my bulletproof vest on.
Nice. Who doesn't like Jason Statham? Go Jason Statham. I like him.
And all I can think about is the ton of cancer that I'm getting with every picture she's taking. She comes back into the room and she's like, okay, let's take a look at those pictures of your cancer. I mean, your teeth.
One x-ray is like one plane ride, but a CT scan is like thousands of x-rays, so it's a little bit different level.
She tells me my one wisdom tooth is coming in sideways.
Which is common. Your wisdom teeth are the very back molars. They come in kind of later in life, 18 years of age, 20 years of age, and they can come in different angles. They can get impacted, which they're pushing against the other molar in the back.
When I finally get to the dentist, I'm like, get it out of me. So the plan was not to put me under, but to dope me up enough.
Sometimes a regular dentist will use it because dentists are not accredited to use those different medications versus an oral surgeon could use these different medications for conscious sedation.
So I start falling asleep, which is good.
Yeah.
That's what happens to most people. They fall asleep and they take them out and they never even know what happened. They don't even remember anything. But I wake up right when they start. And I remember everything they did. I remember the sound of my tooth.
The sound is the worst. The ripping, pulling, snapping of the roots coming out of the bone.
I can remember the drill. I can remember the blood. His foot was on my head for leverage. At one point, he looked directly at my eyes and seen they were open, and he didn't say a damn thing.
Oh man, the silent eye contact of like, hopefully we can get this done over with, because he's actually still using local anesthesia to the tooth, so it's actually numb, but you're typically using the gas to calm you down.
The last thing I remember is them wheeling me out in a wheelchair with a prescription of Vicodin, and I'm just like, do I look pretty now? So $800 later, I'm left with a bloody mouth and a traumatic experience. At least they gave me the Vicodin, because I could probably sell it to a lady at Kmart for half my money back.
Don't do that. There's so many times where people will come out of anesthesia or even the moderate sedation and just kind of be goofy, funny, wacky. So giving the patient Vicodin, which is Tylenol or acetaminophen with hydrocodone. It's illegal to sell the medication to anybody else. It's illegal to give your medication to anybody else.
First time that I got food poisoning. I ate a very delicious, but very tainted beef and cheddar sandwich from Arby's. And this naturally gave me a very bad case of the poops several hours later. Now, what do I mean by a very bad case of the poops? Well, if you've ever read the classic Aesop's fable, The Boy Who Cried, I got a and I got a right now, you'll know exactly what I'm talking about.
Most of the time, anybody who is having bad diarrhea will say, oh, I got food poisoning. Yes, it could be related to food and different microorganisms that could cause that, but I also think of other things that could do it. Like influenza literally can give you the similar symptoms of food poisoning. The very much concern about this is finding out the cause, making sure it is just limited based on symptoms in the sense of it'll go away on its own. It's called self-limiting.
You see, what would happen for the next day and a half was that my stomach would be all like, and then I'd have precisely 14 seconds to find the nearest toilet before my hole fell out in a river.
That's the worst. If you gotta go, you gotta go. Tighten that up, pucker as hard as you can. Make sure you don't poop your pants. Don't fart, because then you might actually shart yourself and it burns, it's uncomfortable, and then you're also going so often that you're using so much toilet paper, you're rubbing your buttocks raw. I always suggest to people using some sort of butt wipe, something more soothing if you're in this situation. You also increase your risk of getting hemorrhoids if you're going this much as well.
As soon as I reached the toilet, instead of out a cascade of ickiness, all I could muster out would be like half a turd at the most.
Yep.
Oh, what the f? That was it? And this would repeat, oh, I don't know, every 20 minutes or so.
Awful.
Just over and over again. You know, stomach, bathroom sprint. Ah! They're probably gonna want to make me poop in a cup so they can analyze it. And that's pretty weird if you ask me. What do I gotta do it in the office while the doctor's making eye contact with me?
In the emergency department, we'll actually ask for a stool sample, but we're not gonna make you poop in a cup. They're actually these toilets that we can actually collect a sample in. It helps with knowing what the pathogen is, but most of the time it's self-limiting and will go away on its own.
Or do I do it at home and Yahtzee shaker?
Please put a lid on this, put this in a plastic bag in case it falls. Yahtzee!
Just bring it in Monday morning like, hey, here you go. Here's a little bit of me that you can test or put under a microscope or whatever do with it.
We will take a sample of it, we'll put it on petri dishes so it can grow. They'll look at maybe potentially under a microscope after they dilute it down. We'll also test for parasites. We'll also look for white blood cells, red blood cells.
Hey, you guys like my sweet Richard Nixon skateboard? Michael, where the hell did you get that thing? My stepdad said he found it in the river. Come on, you guys, let's go to Tom's Donuts. Now, Tom's Donuts was this little donut shop around the corner, and we like to scooter around in their parking lot. Check it out, guys. I can do a kickflip.
Nice. You got a skateboard, everybody else got a scooter. Who out there has got one of those like Razor scooters? I do see people come to the ER on them, sometimes even having accidents via them.
Oh! I go to make the jump, and my front wheel nicks the top of the barrier, and I soar through the air like a goddamn superhero. I land in the middle of the street and damn near snap my clavicle in half.
Most of the time, you deal with road rash, abrasions, maybe some lacerations. You can crack your head on the concrete, it could cause a fracture, internal bleeding. Not a good situation.
Some lady driving a Oldsmobile has to slam on her brakes. God damn you kids and your midget scooters!
I mean, it is funny. Like, you're getting yelled at and you're injured. Make sure you're wearing a helmet. Make sure you're wearing clothes that cover all areas of your body, just to minimize like what potentially could happen.
Or they're trying to apologize, but in the process, I bit my tongue so damn hard, you can barely understand my I'm sorry! I'm sorry I almost made you murder me with your Oldsmobile!
I've seen people with tongue bites that have bitten off like half their tongue. They bleed a ton. We actually don't sew them back together. They will heal really, really fast. But if there's a massive defect, we'll help try to suture it back together.
Well, it's safe to say that kid's not the Tony Hawk of mini scooters. Yeah, I'd say more like the Tony Hawk of eating. At this point, my ass can barely walk since I just myself up 6 different ways. I have to use Michael's 1970 skateboard as a ambulance back to my house. Holy hell, are you okay? Do you need mouth-to-mouth?
Mouth-to-mouth is not actually used very often. Typically, if somebody is in cardiac arrest and you need to do CPR, you identify if the patient is not breathing and does not have a pulse, then you do hands-only CPR. Now, if there is medical personnel on scene, yes, obviously we're not doing exact mouth-to-mouth, we use a BVM, which is a bag valve mask, where you put a mask on somebody and you breathe for them.
One chip challenge. And for those of you that don't know what the one chip challenge is,
no.
well, it's a single tortilla chip that's supposed to be the spiciest, most hottest tortilla chip in the world.
I think it's the Carolina Reaper and the Scorpion Pepper. What?
Now, I didn't know anything about it until my wife brought it home from the store one day. So like 15 seconds go by, and I have no heat whatsoever. I start thinking, maybe I got a dud. Maybe it's expired. Did I wait too long? What the hell happened?
That literally happens when people here in California, where it's legal, will do edible, say, marijuana. They'll literally wait, don't feel anything, and take more, and that's how they end up in the emergency department seeing me, because now they've taken too much.
And just when I thought that...
Oh God.
I can't breathe. Now, thankfully, the heat only lasts for about 15 minutes or so. What I found out is that the heat doesn't go away. It just moves on down to your stomach.
Awful.
So now it feels like this goddamn chip is just hanging out down there, melting my insides with a hairdryer. Well, now how am I going to solve this conundrum? Well, I'll tell you what I did. I ate an ice cream cone. Seemed like a good idea at the time.
Actually, okay, I would do the same thing. Something's hot, you want something cold and basic. You know, people use milk, right, as a neutralizing agent.
It seemed like that ice cream cone would go down there and start beating that chip's and that seemed to be the case until my stomach was like... Yeah, apparently that ice cream cone wasn't beating the chip's it was playing patty cake with it instead. Now, all of a sudden, I get these stomach pains out of nowhere, and they are debilitating.
Just be careful what you're ingesting in your body.
Because at this point, the chip transfers over to my intestines, and my intestines were like, no thank you, you can go yourself with that, and promptly sends it right to my hole.
This is actually a really good graphic because it shows that your stomach is actually really high up, and then you have your large intestine, small intestine, which are more going down lower towards your belly button.
Now, I don't know if you've ever had the pleasure of an on-fire butthole before, but let me tell you, it's not as fun as it sounds. Sounds like there's 14 people taking a once in there. Are you all right? Should I call the cops? The whole time I'm sitting there, all I can think about is, oh, that's why they put the chip in a coffin, because the coffin is for your pull afterwards. Now I get it.
Most people will feel that way. It's not good. It's potentially dangerous. Could have caused bleeding, maybe.
Growing up, my cousin David, he had a chemistry set. And for the record, he did have normal toys too. He didn't just have a bunch of toys from the Great Depression. Hey, you guys want to play with my Tinker toys?
Oh, that's so sad because I had Tinker toys growing up.
Can't even pronounce the names, half the chemicals we're using. Potassium pomegranate. Potassium pomegranate, yeah.
Potassium
that's it.
pomegranate,
Pretty tasty.
okay.
Gulp.
Okay.
So we decided to do what any kids would do, and we mixed all the chemicals together in one beaker. I'm not sure what we were trying to accomplish.
Don't drink chemicals in a chemistry set, and don't mix them together. Read the warnings to make sure that there are no chemical reactions that potentially occur.
We're about to find a cure for cancer with this $12 chemistry set. No, we sure as hell didn't make that. But what we did make was the color blue. Ooh, fancy. We're breaking some new ground here.
I wonder if they're just labeled some sort of chemical, but really benign, and they're just food coloring to make them color, and see what experiment would happen if you mix different colors together.
Somebody publish us in a scientific journal. Ladies and gentlemen, I've gathered you all here today to announce that at our state-of-the-art laboratory, also known as David's bedroom, we have figured out how to create the color blue. Oh my God. They're geniuses. Somebody get them a medal. So there we are, standing there with our blue concoction. We're not really sure what to do with it. Maybe if we drink it, we could turn into an X-Men. Yeah, or maybe we'll get diarrhea for a week. Not really something I want to gamble on.
Mixing things together, you have to be really careful. These things do happen at the hospital, and we have pharmacists there that help confirm what you can and can't give. If they're compatible in the same IV tubing, do you need specific IV tubing with this one medication versus another?
I had to go to the eye doctor to renew my prescription for contact lenses. And like most people, I put off going to the eye doctor as long as I can, you know, until I'm on my last pair of contacts, and they've been in my eyeballs for way too long. Every time I blink, it makes a sound effect.
Oh, that's awful. Okay, yes, remember, you know, your contacts should only be in your eyes for a certain period of time. Make sure you're using the solutions, make sure that they're clean. You don't want to increase the risk of infection, increase the risk of corneal ulcers.
But every time I stare at that thing, I feel like I'm being set up for like one of those jump scares, like it's 2006 again. Okay, now focus on the big balloon. Open up really big now.
Just a few more seconds and... yes. Okay, good. You saw the demon, right? That means you don't have cataracts or some shit. I don't know.
I haven't gone to the eye doctors in a while either. I know they do like eye pressure tests relating to like a puff. We do eye pressure exams in the emergency department as well. Different emergency departments have different exams or different devices to do the exam. There's an old device called a Shiatsu, which actually uses weights. Then there's something called a tono pen. Different types of lasers or magnifiers to be able to see into the back of the eye. But I can assure you we do not have the demon test.
And the next test, of course, is that piece of glaucoma test that everybody hates. This lady pulls out a little handheld
Oh, there
thing.
it is. Actually, that's the one. That little handheld thing is super easy and doesn't hurt. I've done it without numbing medicine of the eye, but if somebody's concerned, we can actually use a topical anesthetic and you won't feel anything.
So she pulls the hammer back on this thing and points it at me all execution style. All right, now you might feel a little tickle on your eyeball. You ready? Are you holding your breath right now?
Can you just get it over with already?
Now, I'll be damned, but this lady was correct. It is just a little tickle on your eyeball now. So now I'm feeling pretty good. That is until they make the arbitrary decision that they need to dilate my eyeball.
Eye dilation is awful. I've had it done myself. Everybody who goes to the eye doctor gets dilated, basically. But in the emergency department, we typically do not dilate your eye. So we do our best to look in there. So the reason why you dilate the eye is to dilate the pupil. So that way you can see into the back of the eye, the vessels and the retina a lot better. In the emergency department, we don't do that. So a lot of times we're shining a light and it's a little pinhole that we're looking through and doing our best to take a look back there.
First, they drop battery acid into your eyeballs, and then they make you Stevie Wonder your back out to the waiting room for 15 minutes until your pupils look like you just dropped acid. Now they offer an alternative. Okay, so we can dilate your eyeballs the old-fashioned way with the battery acid, or for an extra $35, we can skip the dilation and use this new fancy machine that we got. $35? Lady, I would have ate stuff out of your garbage can if it got me out of get my eyes dilated. Sign me up. Hell yes, eye doctor in 2023. I would buy a t-shirt at this point if they had a merch shop.
I love it. This is actually hilarious. I didn't know that they offered this. We don't have these special machines in the ER. That's why, like, when people come into the emergency department and they want to see an eye doctor, they have to go to the office because all their special equipment is there. It's not actually at the hospital.
So finally, the opening act is over, and now it's time to see the headliner, the old Big Daddy Eye Doctor himself. But this guy burst in the door with the energy of like a 90s game show host. Hey there, howdy who, I'm Dr. Sunshine, who's ready to play the Family Feud. I'm here for contact lenses. Yeah, I see that. Tell me, how long have you had those crusty things in there for? Not too long, really.
The crunching, aka the dryness. So if the contacts have been in for a long time, you increase the risk of having injury to the cornea itself, which is the clear layer of cells that is over top of your iris and your pupil. Very sensitive. So if there is injury to it, a lot of times you can use drops, and sometimes you might need antibiotics to help it heal.
Out of hell with that, I'm not going to school today. I'm gonna pretend that I'm sick, goddammit. Now you gotta try to figure out a way to give yourself an artificial
Who doesn't like Three's Company?
That's
amazing.
Right, try to raise your body temperature up to a solid 101, 102. Then you walk out to the living room and lie straight to your mom's face. Hey, I don't feel very good, and I've been pooping a lot. You've been pooping a lot? How much is a lot? Like 16 times? 16 times? Holy hell, we need to get you to the hospital.
If you have diarrhea, that is probably the easiest way to be like, no, I can't go to school. But you want to make sure that there's no blood in your diarrhea and you're able to keep fluids down.
Whoa, wait a minute. All right, maybe not that much, but my head feels really hot, though. Good Lord, you are burning up and you smell like hot plastic for some reason. Okay, you're not going to school today. All right, mission accomplished. You did it. You tricked your gullible mom into letting you stay home from school.
Who out there has attempted to try to trick their parents that they're sick and they can't go to school? Be careful. You don't want to raise your skin temperature too high and cause a burn. The best way to actually take a temperature is a core temperature, typically rectal. Then the next best would actually be in your mouth.
So now you're laying on the couch like it's your own personal gurney. You don't even have the decency to change out of your Hong Kong Phooey pajamas, for Christ's sake. Your mom's serving you Pepto-Bismol by the gallon.
Pepto-Bismol, not bad. It helps with an upset stomach, but Pepto-Bismol can change your poop to black. It is a normal side effect, no freaking out.
Make sure you drink all this. It'll slow down all those escapades you've been having. I know most people hate the taste of Pepto-Bismol, but when I was a kid, I loved that weird pink milky Like, my top 3 favorite drinks when I was a kid would be like Mountain Cooler Capri Sun, Ecto Cooler High C, and then
Boom, Pepto-Bismol,
Oh my
somewhere in
gosh.
between.
I'm not a Pepto-Bismol fan. If somebody's having like stomach discomforts, maybe reflux, I typically like either Mylanta or Maalox, actually. I'm okay with people trying to use Pepto-Bismol as an attempt to help their symptoms, but if it's not helping and feeling like they need to down the whole bottle, you need to get checked out.
Since I never drank before, I had the alcohol tolerance of a diabetic third grader. So throughout the night, I'm getting my ass kicked in, and I'm having to take shot after shot like I'm Superman. Gulp, gulp. Oh god, it tastes like spicy piss. I hate it. And contrary to games like bowling or pool, I don't get better at euchre the more that I drink.
I don't even know what euchre is. Yes, they actually have done studies with people drinking. Sometimes a beginner or a novice may actually do better after 1 or 2 drinks because it decreases stress just for that short period of time. But then your thinking, your coordination, everything actually becomes impaired.
Halfway through, my liver's yelling at me from the inside and stop calling Trump when you're
Oh, I like the liver picture. That's funny.
Needless to say, about an hour goes by, and all of a sudden I'm drunker than a stepdad at a Little League game.
So there's actually no good positive benefit to alcohol in the sense to your body. It is like a toxin. And so your liver is the organ that helps filter out toxins. And you can see in this image, it's actually this yellow thing is probably most likely the image of your gallbladder that sits underneath your liver. There are ways that you can actually protect your liver out there from different damage, or actually even just like support it. Lots of hydration is one.
Gulp, gulp. This doesn't taste like spicy piss anymore. This doesn't taste like anything anymore. So I stumble into the bathroom, and like a lot of people do their first time getting drunk, I look into the mirror, and I meet my drunk self for the first time.
Yep.
Whoa, wait a minute. Who the hell
gosh.
are you? Oh, well, I'm the drunk you. That's who I am. I'm a lot like sober you, but louder, and sometimes I think I know how to dance. Oh, okie dokie then.
So alcohol, obviously, I'm describing that it basically disinhibits you, so you can be maybe a little bit more confident, do things that you normally wouldn't do. But on the flip side, you also probably believe that you're awesome at all of those things. You just have to be careful with drinking too much alcohol. It could impair your judgment. If you drink too much, you increase the risk of vomiting, having abdominal pain. You can actually get pancreatitis, which is inflammation of your pancreas, and then obviously causing damage to your liver.
Today, I just bought my most terminally ill fan his replacement heart. Oh my god. Is that Mr. Beast?
I was just thinking that. I'm like, why does this person look so similar to Mr. Beast? You have the monitors in the back, you got the IV fluids going, really good depiction. And if I'm looking at the monitor, the heart rate's going good. The blue line in the back is actually the respiratory rate typically. So the respiratory rate of this individual is cruising. It is going fast. That's not normal. The heart is actually in a cooler. You'd be actually surprised that they get transported in a cooler, literally by somebody in a car from another facility, not even an ambulance per se.
Do you want a heart to save your life? Or do you want a Mr. Beast wrap Tesla?
Good boy.
Now, you have to search these 100 coolers filled with human hearts to find the Tesla key.
What? Wait a minute. No, it wouldn't be directly on ice. It would be wrapped and it would be in like a cool container, but not necessarily on ice because you don't want it to get frostbite or freezer burn, right? Because you don't want it to actually get frozen to that tissue.
Man, I wish I was terminally ill. Your boy be driving a Ford Explorer.
Bruh. So the monitor is giving the asystole noise, like the brrr, because it's not on the monitor. So if we actually ever hear that noise at the hospital, the first thing that we do is actually check to make sure that the monitor is attached to the person.
Yeah, I mean, I don't know if this guy should be doing this.
Oh my gosh. Why is the guy with the yellow shirt stomping on a heart? It's funny stomping on it, but I've actually literally held a heart in my hand like multiple different times, and they're super delicate, super soft.
He looks really sick, Jimmy.
And this guy's just throwing them around. What was that? You would expect the hospital staff to come running in to check the patient if the monitor is going off like that.
Man, I'm looking to play some Among Us with my boys.
The belly button is actually like a crazy, interesting, weird part of our bodies, but that's literally how we got all of our nutrients into our body from the womb via the placenta.
Oh my god, it's Mr. Beast! Oh, been a fan since 1 million subs. Oh, man, this is awesome. Always great to hear. Here's $5,000, and we just planted 2,000 trees outside of Liberty, Missouri in your name. Thanks for being a fan. Bye-bye.
Oh my gosh. We're not allowed to accept bribes. We're not allowed to really accept large gifts either. Sometimes, you know, patients will give food, cards are fine.
Well, I have a donor coming out of state to bring me a new heart in a few days, so I think I should recover okay.
I'm not sure exactly what he means by having a donor come in a couple days, because typically a heart outside of the body only lasts anywhere between 4 to 6 hours.
All right, children, gather round. Today we're going to go inside of a beehive or, I don't know, a flower or some shit.
Miss Frizzle, I don't want to learn about that stuff. I want to learn about wet-ass pussy. Wop, wop, wop.
You can't say these things at school. Come on. Oh my gosh. Like, no. No, 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 no.
You all know I hate that song so much.
Miss Frizzle.
What? The thing I always worry about when somebody gets hit on the side of the head is if they actually have an epidural hematoma, basically a bleed in the brain where you have a laceration or injury to the middle meningeal artery.
Hop in the bus and let's get to learning. Whoa, this place is cold and stinky. Yeah.
Oh my God. I feel like I'm in the female anatomy and we are in the vault, the vaginal vault. It could have odors for multiple different reasons. There are good bacteria that grow down there to protect it. Sometimes there could be overgrowth or abnormal growth due to taking medications or antibiotics, which are normal. And if there is any odor that is down there, you definitely need to get checked out by your physician, your OBGYN, or your family medicine or internal medicine doctor.
Help me, please.
Waterform attack!
A puncture wound knife to the lateral aspect of the neck. You have your carotid artery and your jugular vein. And if you hit that, the vein's going to ooze out blood, like pool out like it is. And then arterial blood will be arterial or shooting every time that the heart is beating. And you can bleed out pretty fast. Can anybody like pinch their nose and suck it so it like stays shut? I mean, that's a skill to have. Let me try. No, mine doesn't.
Are you the dentist?
Why, yes, this is my practice.
We need your help. My friend is in desperate need for oral care.
Oh my goodness, I like it. Oral care.
We are totally booked for the day. Almost the whole town was assaulted by a flying creature.
Usually people with acute dental or mouth injuries will come to the emergency department, and there are certain things that we can do, but most of the time we temporize it so you can actually get to the dentist the next day.
We have a bag of teeth.
Wow.
Tooth Fairy, just easy down now, okay?
Did you guys ever believe in the Tooth Fairy, or do you still believe in the Tooth Fairy? Let me know in the comments.
Jesus Christ, please don't act up.
Oh, hold on to the Tooth Fairy. Oh my gosh, the fury.
Daddy.
That wasn't even like using the pliers to pull the teeth out. That was just destruction. Oh my gosh, oh my gosh, oh my god. What was that? Now, typically we actually see people's teeth fall out from different types of trauma. A lot of times they'll get fractured through the tooth that's actually sticking out versus a fracture where the tooth is up into the bone.
I wouldn't mind.
What?
Oh, I have teeth again. Where are we?
What? Oh my god, sometimes that happens when actually somebody uses any type of anesthetic or agent that they might use to have somebody, you know, do conscious sedation or be put to sleep. When they wake up, a lot of times you're confused. What's the situation? What's going on? But we always keep you on a monitor until everything clears out of your system.
Today, I'm going to be curing someone with total blindness. We will be using a new artificial lens that will give this person sight for the first time.
Okay, so if you're putting in a new lens, typically that means that the lens of the eye that you currently have is not working, and the most common reason for that is cataracts. Basically, that is clouding of your lens, making it really difficult to see.
I'm very excited. Remove the swabs.
Remove the swabs. The only time I've ever really put these on somebody's eyes if they have an arc burn from a welding torch where they actually cause a little bit of burn to the cornea itself, and every time you blink your eyes you're actually scraping off new cells that are trying to grow, and it hurts like a son of a gun. Yep. I think that's really funny and cool that the pupil looks like the symbol of Mr. Beast. It's really funny.
Okay, we just needed to sign a couple of release forms to be in the video. All pretty standard stuff.
Oh!
Is everything okay?
I don't think the lenses of the eyes would cause that. Maybe emergence phenomenon out of anesthesia. Sometimes people who get anesthesia will have abnormal reactions, have weird, trippy dreams.
Yes, I'm sorry. This whole experience has been very emotional for me.
Please sign.
Sometimes you can actually have a type of delirium that occurs when you're actually in a hospital. We typically see it more with a very, very sick population as well as the elderly population. You typically will develop if you are an inpatient and you've been there a while, been under a lot of mental and physical stress.
Sweetheart, are you okay?
Oh my goodness.
Subscribe to Mr. Beast!
Sometimes we have auditory hallucinations, visual hallucinations. Historically, there's been some messed up people that have actually done things to people who have been under anesthesia. There's a huge spectrum. Oh no! Did he cut his own eyes out?
God.
Oh my gosh. I've never seen somebody actually attempt to take out their own eyes, except for in like TVs and movies, but in real life, no. Wholly painful. Oh my gosh, very extreme.
I don't want to see. I don't want to subscribe. Please don't make.
Why would his head be wrapped for a cataract removal or putting a new lens in? That's pretty much your anterior chamber of the eye. You wouldn't need to go into the back of the eye making incisions, so that doesn't make sense. Maybe more for dramatic purposes they would do that.
Here, take the picture for the thumbnail.
Please don't give.
So messed up. This poor kid who's in so much distress, not necessarily from the eyes themselves, but probably from the surgery and effects thereafter of being in the hospital.
I don't want this.
I don't know. It looks kind of weird, man. I don't know.
Hey, it's fine. We'll just upscale it with AI or something. We'll be fine. Let's go.
If you lost your eyes by cutting them out or getting massively destroyed, can you replace the eye with like a new eye that would actually function? No, we don't have the ability right now.
I'm limited by the technology of my time.
What do we have here?
Yeah, Rick. Yes, that's Rick from Pawn Stars. First, gotta mention the wrists. Those are the smallest wrists I've ever seen. You know, there's a lot of important structures that go through your wrist. All your major blood vessels and nerves going to your hand. Our hands are so important as human beings, so they should be functioning really well.
They can touch anything but themselves.
Jesus was the Son of God. I mean, this guy was a big deal. Is he still operational, or I mean?
Yes, sir. Yes, he is.
Okay, well let me stab him once here. Okay. One more time. One more time for good measure. Wow, how cool.
Oh my gosh, this is pretty messed up. I've had somebody come into the emergency department with a piece of wood and a nail stuck to their hand from a work construction site. I had to, take the nail off to separate all the pieces, but nothing to this extreme. Obviously, if this rolled into a real store, you would call the police.
I was just wanting an easy $2,000 for this dude. Keep the wife happy. You know how it is.
I mean, it's talking about his wife being happy, and he's wearing a t-shirt that's got a bride and a groom saying game over.
Deal breaker.
Thanks
Thanks for coming in. So, what can you tell me about this guy? I mean, is this the real Jesus Christ? The way the nails are hammered into his wrist?
Please don't touch it. Please don't touch it. Don't move it because it would actually hurt. Typically, if we had somebody in a situation like that, you try to numb up that area. You can potentially do a nerve block, but in that situation, due to the pain, you might just knock somebody out with medication so they don't have to feel the pain and remember what happened.
We have paintings of Jesus with nails through his hands, but it was in fact his wrist.
There's always the question of nails between the wrists or in the hands, and just from an anatomical standpoint, the wrist makes more sense because it goes between your radius and your ulnar bone, which would probably hold your body a little bit better than if you put it through the hand, which are smaller bones that could then slip through.
Karen from Facebook. Essential oils. These were the ingredients chosen to create the perfect little girl.
Essential oils is its own separate place in the universe. They're basically plant extracts. I don't use them at the hospital. I don't know of many physicians that do. The biggest concern as a physician is if the essential oils will actually be messing with the current medications that you're taking.
But Karen accidentally added an extra ingredient to the concoction. Fear of autism. Thus, the anti-vaccination girls were born.
Okay. Vaccination and the fear of autism has been debunked. The individual who did the study had said that he lied on the data.
Using their frail, disease-ridden bodies, Blossom, Bubbles, and Buttercup have dedicated their lives to being susceptible to almost every disease known to man.
Vaccines, they serve their purpose. They have prevented a ton of diseases out there. I'm a physician. I'm fully vaccinated. Many more people are alive because of vaccines.
Bring me his jaw.
Bring me
Just
his
hold
jaw.
on a second.
Enjoy the silence.
What? The mandible has been ripped off. Now, unless you have superhuman crazy powers, you're not going to be able to rip the mandible off. I have had to relocate a dislocated jaw, aka a dislocated mandible, which takes a lot of strength and a lot of force to be able to do that. Some people may be able to survive, but have lost the mandible. Could you put a fake one in versus do you just not have a bottom jaw and you can't chew anymore? And there's some difficulty with speech, but you're alive. And you know, there's also the issue of just having to grind up and drink your food versus actually chew it.
Alrighty, here's your prescription.
Thanks, Doc.
That's real doctor to you.
I get a lot of trolls, you know, haters out there that say, oh, you're not a real doctor. But I have a full-time job that I work in an emergency department. I actually have 2 jobs and I actually work at a 3rd hospital. So I work hard at being a real doctor.
Because don't worry, I'm a real doctor.
If you're ever concerned that a doctor is not who they say they are, you literally can look them up and you would actually be able to find where they went to medical school, where they got their degrees from, what board certification they have.
Anxiety, eh? Well, I've got just the thing. Take 3 mouthfuls of these bad boys. Also some uppers to keep you awake and some downers to level you out.
And I've actually seen that where patients will come in with medications to help the stimulants to get them up. And then I see the same patient have medications to bring them down. It's like, well, why can't you just take no medications and just be normal?
Maybe some hallucinogens in case you get bored. Remember, real doctor here.
Oh, that's not good. Don't ever do that. Now you're seeing a depiction where somebody's just downing all these medications. It's called polypharmacy. And you have no idea what the interactions of these medications are inside the body. You really have to look and see what type of interactions could occur. There are resources online where you can actually put different medications in to see if they're compatible versus if they have adverse reactions to each other.
I don't feel so good.
Upset tummy? Say ah.
Oh, don't. Oh, this is how you kill a patient.
Gram of this, a dime of that, a few pounds of this stuff. Hook that right up.
This is the police! Open up!
I commented on a video I've done before where I let people know that there's liquid cocaine at a hospital. And people lost their minds. Cocaine is like an anesthetic as well. It also causes vasoconstriction. Think about it. Novocaine, lidocaine, benzocaine. These are all canes, right? So they're all kind of the same family, but they're all anesthetics.
What
What's happening to him, Doctor?
I'm sorry, Mrs. Henry.
Oh man, looks like very cachectic. Very cachectic meaning like very sunken in and lack of tissue and skinny and almost like very sick.
But your husband is suffering from a rare, rapidly advancing form of arthritis in his ribcage. His bones are eroding at an abnormal rate.
There's no such thing as ribs eroding through arthritis. Typically, arthritis occurs at joints. What?
I'm afraid he doesn't have much longer.
Is there anything we can do?
Well, we could do this!
That is so messed up. He just killed him. EKG monitor. What? That is so cruel. What? When somebody dies, there are steps you have to do to confirm that they're dead. Check your pulse, check for respirations, not just poke somebody in the face with a musical instrument.
Not to be a dick or anything, but your daughter's spine is broken, her body is riddled with blood clots and viruses, and she's got a bunch of tumors in her head. There's nothing more we can do for her.
Wait a minute. Broken spine, viruses, blood clots, tumors. Like, what the heck happened to this poor kid?
How much time does she have left? Only a tiny while.
Did someone say tiny style?
Tiny style, tiny while. Family members and patients will ask doctors if they have a potentially terminal illness, how much time do they have left? So I'm not a big fan of that. If you tell somebody that they have 6 months to live, they're in their brain is already going to put that in. Okay, I'm going to die in 6 months. Versus tell somebody they're going to live for another 20 years. Maybe the median age of somebody going to die with that disease process is 6 months, but maybe they get 2 years because you gave them more to live for. I think there's a huge lesson to be learned even from physicians. We need to kind of be wary exactly what we say to patients because we do greatly influence potential outcomes. Oh, cruising on. Look at that. That's really cool. Red blood cells. They look like donuts. And there's a big ball of it, which is probably a blood clot. A little off, but pretty good.
What's this? Her bloodstream. It's cleared up.
This little character is just cruising through the body, just breaking clots up. It's probably related to like thrombolytic type agent.
The viruses, they're vanishing.
Oh, so cool. I love that there's a battle with these bacteriophages and then the viral load is going down. These viruses are infecting and replicating within bacteria, and that's why they're called bacteriophages. Very cool structures. Whoa, everybody. Oh, the back is fixed. And the tumors are removed out of the ear.
Why, your daughter is completely cured.
That's super cool. A lot of times I wish we had super things like that to fix people. But a lot of times treatments that we actually have nowadays for cancer, you're trying to kill any rapid dividing cell, kills the tumor without killing you first kind of thing.
Now, before I can prescribe you any of these grown-up drugs, I've got to run a few quick tests. Well, that's never a good sign. Do you feel that?
Reflex hammer on the knee, you're actually hitting the patella tendon, which then some people are hyperreflexive or hyporeflexive or normal. You get the classic like boing, you know, kind of thing, and it feels weird. You can actually do that in a lot of different tendons of your body. Okay, come on, doc, you know.
Turn your head and cough.
Totally inappropriate, just shoving your hand to do an exam, basically looking for a hernia. The turn your head is so you don't cough on the doctor. The reason why you cough, it's to increase intra-abdominal pressure to see if there's a defect to where you would have a hernia of small intestine or fat go into the scrotum or just next to it. You probably just punched one of them in the face.
Well, you're not looking too good. I mean, you're lumpy in all the wrong places. Plus, your spine is so crooked, it's a miracle you can even stand. I'm going to have to give you some of the best drugs we've got.
Oh my gosh.
But a word of caution, these drugs are going to make you see some weird ass.
Don't know what medications he's going to give that's going to make you see weird stuff. Pain medications could sometimes cause you to feel weird and hallucinate a little bit. There isn't a medication out there that doesn't potentially have a side effect. So just something to be aware of.
Scalpel.
All right, we got some music in the OR. It's normal. It looks like they almost used like a 10 or a 15 blade scalpel, and looks like they're taking out the heart. And the heart is still beating a little bit. Now the question ends up being, people are going to ask is, can the heart beat outside of the body? Typically not after like a beat or two, because it functions based on blood flow as well, even though there's an electrical circuit to it.
Donor heart.
Donor heart is a piece of cake?
Wires.
And a candle.
Wait, what?
Happy birthday. That's so messed up.
Make a wish.
He's got a mask on anyway. I
have no choice.
Oh, that's not sterile. No, that doesn't happen in the operating room.
Hey, Doc. I just want to say thanks for saving my life. You're a miracle worker.
Also, your heart is a cake. Mom.
Oh my God. Can the person survive with the heart outside the body? Yes, as long as their blood is being pumped through a machine that's connected from basically an outflow to an inflow. Now with the COVID-19 pandemic, we actually will use a device basically called ECMO, which is extracorporeal membrane oxygenation, where you actually shunt the blood outside the body and then get it oxygenated, almost like using your lungs, and then bringing it back in. Pretty crazy what we can do. So ECMO is not like your first go-to. It's a last-ditch resort if somebody is basically on their deathbed trying to save their life and trying to buy them time to allow the body to heal itself.
The craziest thing, Doc.
And out.
I put a mouse up my ass. You know, when I kind of feels good.
Oh my gosh. Surprisingly, people come to the emergency department often enough to have a conversation where things go up there, and for whatever reason, they don't appropriately think about trying to get it out after.
So I sent my cat in after him. So an hour goes by and my cat's still up there. And I start to get worried. I mean, one more dead mouse.
I love how the doctor just ignores him after he says that comment.
Left shoulder?
So I offered to take my neighbor's dog for a walk.
And once more over my right shoulder.
So I put a few slices of ham and some spicy mustard on the old beehole, and sure as shooting, he took the bait. I was hoping the dog would like cause a ruckus and scare my cat into coming out. No such luck.
So if somebody comes in with a foreign body in their rectum, we get an x-ray, see what it is, make sure we're not blindly sticking our fingers in there. It could be sharp, it could have a needle, and we don't want to poke ourselves. We want to, as ER doctors, try to get it out ourselves first, because if we don't, you have to go to the operating room.
Which makes me worry about the chicks I put up there earlier. I mean the baby chickens, not the 3 hot girls.
So what seems to be the problem?
Oh, I got a little tickle in my throat.
Here's a prescription for some cough drops.
Thanks, Doc.
You can have a doctor do an endoscopy, a sigmoidoscopy, sometimes colonoscopy, and then sometimes literally you just have to be knocked out so they can actually stick their, not just a finger, but like a hand in your rectum to be able to grab whatever's in there. And then worst case scenario, you have to be opened up from the front side.
You ever wonder why men have nipples?
It is actually an interesting topic to be brought up. Why do men have nipples? There could be hormonal imbalances or related to cancers that can have a male potentially lactate. It also has to do genetically in our chromosomes, having to do with specific ducts that get turned on, off.
Like, they don't produce milk. At least, I don't think they do. I guess men can lactate from hormone imbalances or whatever. And they're definitely not, like, evolutionarily advantageous. You know, like sexual selection? Like, no one's attracted to that. Chest, maybe, but not the nips. And male animals have nipples, too.
Dogs have
Oh my God. Men go through puberty. There is some structural changes that occur, and that has to do with hormonal changes.
Hey, are you even listening?
Nipples are not speaker volume knobs.
We need a medic here, stat! Oh, hold on, sir! No, don't move! You were in a terrible car accident. You're at the hospital.
Need some help over here. It's really good. You get confused. You might get combative because you don't know what's going on. Your brain's been a little knocked around in the sense that it's had trauma potentially. So it's good that the paramedics are trying to kind of reorient. I know it's a show. You have a seat collar on to protect the cervical spinal area so that you don't get further injury if there's a fracture.
All right, coming through.
IV is open. How's his pulse? Blood pressure? 85/40. Pulse is 120 and steady. Possible hypotension.
Oh my gosh, so these are actually really good. Get fluids going because the patient's hypotensive and tachycardic. So blood pressure low, heart rate up. That's basically a sign of hemorrhagic shock.
I'm here. Let's save this man's life.
If you're doing a sterile procedure, then you'd actually need sterile gloves. But even then, there's techniques to put them on yourself.
Oh, thank you, doctor. All better. Oh boy, you saved my life. Good job. I'm.
Oh! What was that? It's hard to tell, but I'm assuming it's part of intestine and maybe stomach. You have your rectum to your large intestine. We're going backwards. Then your small intestine up to your stomach. Probably a stomach that just came out somehow. That needs to be put back together.
We couldn't find any more IV tubes, but we did find these crazy straws from the cafeteria.
Same thing in hospitals. You can actually run out of supplies related to IV tubing, IV needles. Manufacturers aren't keeping up with the demand and there's no supply.
That crazy straw idea just might be crazy enough to work.
In this case, you have to do some sort of MacGyver movements. MacGyver meaning like coming up creatively with a way to deliver what you need to deliver to the patient.
Live, damn you! Oh, it's not gonna make it.
It'll make it.
Here comes a loop. Oh God! Holy shit, it did it!
Look at it go!
Oh, baby, yeah!
Oh my gosh. Yeah, no. The straws obviously are not sterile, so that would be your first thing. And then, could it actually work? Maybe. I think you'd probably have to tape the seals.
Yeah, he's been dead for a few minutes.
Now, if a patient can actually take fluid by mouth, it's actually better than getting it intravenously, just because you absorb it better into your body and stays in based on volume. I don't think fluids was going to save the person's life. Now, you gotta do CPR and then see if there's a shockable rhythm. Oh, wait a minute. Okay, real university, doctor, real doctor, MD, a real doctor. There are a lot of doctors out there that actually even have medical practices that aren't supposed to be practicing medicine. If you ever have a concern about your doctor, there is the National Practitioner Database. You can look up a doctor. You can pretty much find it anywhere you want versus a certificate on the wall.
I should know. I'm a real doctor.
Oh my gosh.
This is the police!
Uh-oh.
Open up! We have a warrant for the arrest of Dr. Lionel Real Doctor on 6 counts of medical malpractice.
The police wouldn't just barge in that moment. We get police officers that come into the hospitals every now and then. Most of the time in the emergency department, we get it when they either bring somebody who's in custody and need medical clearance, a DUI, or even like traumas, gunshots, stabbings. Those are all reported to the police and they need to come to the hospital and start their investigation there.
All right, Dr. Real Doctor, if that is your real name, you're under a...
Not there.
Don't say a f***ing word.
Come on. Hospitals, though, do vet the doctors. Basically a process where they do background check, all this stuff, make sure your credentials are appropriate, and make sure that you don't have any kind of shady background.
Well, Mr. Watson, we have your lab results back, and well, you've got norovirus, hepatitis, tendinitis, syphilis, and salmonella, sickle cell, a rash. We don't know what it is. A toxoplasma, super asthma. Better go call Make-A-Wish. You haven't got much longer, and I haven't finished half my list.
Holy cow, a ton of diseases and infections and different processes. There's a lot going on there. So you got norovirus. So norovirus causes like diarrhea. You got hepatitis, which deals with your liver. It can be A, B, C, D, and E. There's 5 different kinds. Tendinitis, so you have inflammation of your tendons. Syphilis is a sexually transmitted disease that causes a painless ulcer.
Your poop is filled with lupus, all your shit is out of whack. Your heart's diseased and full of bees. A single breeze could end your measly life. And also measles, measles, fecal, beetles, fetal, alcoholic syndrome, chronic symptoms common to medieval people. Your nose has blown, your back is stone, your cells have unknown chromosomes.
Wow. Okay. If I go over every single thing that this doc is talking about, we'll be here for weeks. This is amazing. We're talking about lupus. We're talking about issues controlling your urination. It's just, the list goes on and on. I just don't know where to even begin when it comes to this stuff.
And kidney stones and loads of Crohn's and toenail cheese and pubic fleas and leaky knees and athlete's foot and truckers, but one twisted nut you'll never with any luck you'll kick the bucket soon enough. Also, you're deaf.
I didn't read all the way to the end that the patient is deaf. The American Sign Language we have at the hospitals for people to use if they're deaf. Sometimes family members come in, but we do have options for people who are deaf. In this case, you can also write things down or give a piece of paper with a diagnosis and go over things that way. That was very intense.
Looks like you're a little behind on your vaccinations. Let's go ahead and get you up to date.
Whoa, 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 whoa.
Sorry, Doc. I have a thing about needles.
You know how many people I see that have 8 million tattoos, but they can't take a shot because of the needle? I'm like, wait a minute.
Listen, just go ahead, relax, close your eyes, and we'll make this as easy as possible.
When we do needles, we do procedures, we want your brain and use mental imagery to get into a good place. And actually, it's been proven to help. Now, who likes needles? Nobody likes needles. Sometimes it hurts when we're trying to find a vein, and that's because every vein has a nerve running with it.
Oh, okay.
Alrighty. Janet, is he ready?
Sure is, boss man.
What is this?
Bad news, Brian.
Oh my gosh. We have something called harder strains and softer strains. Softer strains are what you would think, like soft little cuffs. Harder strains are just a little bit harder that have buckles to them, but they're not changed. They're actually Velcro to the bed. The only other time that we see somebody chained to the bed is if they're arrested and they're handcuffed to the bed.
This particular shot is injected optically.
What
the f are you talking about?
Right in your eye. I can't even do it fast or I might go too deep. Might hit the nerves in the back and make you go blind.
Oh my god.
Let's go real
amazing.
slow.
Injections in the eye, you think they're crazy, but they're actually a real thing. Somebody has macular degeneration. The blood vessels in the back of the eye are not functioning the way they should. You can actually get something called an Avastin injection into the eye. So the ophthalmologist, the eye surgeon, will inject this medication through the white part of the eye into the globe, which is the rounder part of the eye, and inject the medicine in there.
Jesus, please, no!
Well, I guess we could go anally? Yeah, let's just do both.
Oh my gosh. So one of the worst injections actually, or discomforting, is penicillin into the buttocks. A lot of times the only way to treat syphilis is penicillin injection, and it hurts because it's like thick and viscous. What kind of ball needle anal injection? No, that doesn't exist. That's horrible.
Okay.
The fact that the doctor's like,
hold still.
Oh gosh. Oh my gosh.
And we're done.
That wasn't so bad, was it?
What the hell, man?
Bet you're not scared of our needles anymore, are you?
Gosh.
And here's a wowie for the widow scaredy cat. Goodbye, widow baby.
Stabbed him in the eye with it. It's actually pretty interesting. When you actually injure yourself and you don't have pain right away, it's when you look at it and notice it and then you tell your brain that you got the injury that the pain actually starts. It's very interesting. And sometimes we will do distractive techniques to be able to help the patient not feel pain. So it is appropriate, but that was messed up.
His spinal disease has progressed faster than anticipated. We thought he had a few months, but it's looking more like a few weeks. There is good news, however. The Make Wishes Come True Foundation made it today, and they brought along a very special friend.
Yeah, coming through. I've got a brave little boy to meet.
No way.
Who's this guy?
Bert the Speeding Bullet Broadway?
In the flesh and bones, little hero. I'm told by my friends at Make Wishes Come True that you have a very special request for your favorite wrestler in the whole world today.
I want you to beat me to death.
Oh man, that's not cool. Got some debilitating spinal disease. He's moving around pretty well and now he's coughing. If you're having a spinal disease, interfering with the nerves, not working with the diaphragm as well, could develop pneumonia because you're not clearing things out and not breathing as well as you should. So that makes sense.
The f you say?
I want you to give me the Bullet Buster. I want you to break my bones with the Bullet Time Press. I want to go out my way with style.
Is it another contract? It's got to do it? What?
I'm ready, Speeding Bullet. Release me from this mortal coil.
Okay.
Whoa.
Little hero.
What? Oh my gosh. What?
Don't make me.
This is not cool.
Bullet Buster!
I'm cured.
Nice. I knew that was going to
alive and
happen.
I'm cured.
Oh my gosh. Okay, the injury is he's smashing in his face. You can have something called Lefort fractures to the face itself, nasal fractures, eye trauma, brain trauma, cervical fractures from the whiplash. Then takes the chair, the steel chair, to the head. And that could probably kill somebody if you really hit them with a steel chair and smash their skull in. And then the backbreaker or whatever move you want to call it. If he's got a debilitating spinal disease, causing a fracture to the spinal column is not going to fix it. Doctors will actually re-break a a bone to reset it.
And that should do it. Back on your own two legs.
Who's this doc?
So to speak.
I don't know.
Got a wooden leg.
A little outdated?
Nonsense. That's the finest mahogany, double coated with sealant, guaranteed against termites for 5 years.
Well, okay, awesome. I guess.
Off you go.
Nowadays, the advancement of prosthetic that we can use, there's plastics, there's metals, there's different links to your spinal column, to your brain. The fact they're using mahogany wood that's triple coated, double coated, doesn't exist.
What?
It's like a weird prosthetic. Oh my gosh. Gonna break his other leg.
I don't know, Doc. This just seems a little extreme for a broken bone.
Well, you should have told me that before you regained consciousness. It's a little too late now. This is real old world craftsmanship, pal. Now get out of here, buddy.
Come on. Somebody breaks a leg, get some x-rays, put it in a splint, allow it to heal itself. Now, if we have bad broken bones that are shattered, we call it comminuted. Most of the times they'll put it's called intramedullary rod. So it's basically a big piece of metal that goes straight through the middle of the bone where the bone marrow is and keeps the bone structure and allows the bone to kind of grow around it.
Today's the big day. We're just about ready for your brain surgery.
Okay.
You know, your mother told me that you played guitar. It would be really helpful if you could play for us while we operate. That way, you can let us know that you're, well, still you.
Wow. If you're having brain surgery, there are instances where you actually are awake. So the brain itself is insensate. So they may knock you out, do the incision, open up the skull, and then actually bring you out of anesthesia to be able to see the different functions of the brain, because the brain is pretty much mapped out to where we know what the functions are. There are instances where they will touch different spots of the brain and see if things move or there's sensations or weird smells.
You think you can do that for me? Sure. That's the spirit.
Yes. Yes. Nice. Oh. What happened? Oh my God. Nice. Interesting.
Thank you for fixing him, Doctor.
It's very interesting. There's a tumor that's called a meningioma that's typically in the frontal lobe, and the frontal lobe has to do with personality. The tumor grows over time and actually pushes the tissue to the side. It doesn't grow into the brain, and it actually causes personality changes. When you actually remove the tumor, the question ends up being, does the personality resort back? Does it stay? Very interesting process. It's all different for every individual.
You see, Mrs. Shepard, your son had a very rare birth defect. I'm afraid he was born with a serious updog deficiency.
Updog? Come on. What? What's up, dog?
Really? Updog? You think it's appropriate to make a joke at a time like
What's
this?
up, dog?
No, Mr. Shepard, you don't understand. Underprostate dioxyl glucose, or updog, is a vital, naturally occurring hormone. Human beings cannot survive without it.
I see. I'm sorry I got upset, Doctor.
Oh my gosh, what a messed up scene. Their kid has died. So you come in, say what happened, what's the news, why it happened. But I've never heard of this updog.
Let's go check on parents with living babies.
As doctors, we're human beings, we're compassionate. If a doctor does this, they're the most uncompassionate jerk person out there. For a show, it's really freaking funny. But in real life, you actually have to get tested on how to handle difficult questions in different situations. Part of your board exam has to do with the difficult question that you randomly get asked that you have to discuss. Am I gonna die? Do I have cancer? Do I have HIV? What happens if I'm gonna die? Or you have to tell somebody their family member died. These are the questions that you need to know how to answer so you don't come across as not being compassionate, saying something a little off by accident, and just knowing how to have a conversation with a human being when it's a difficult situation.
Come close to meeting my demise a couple of times, but somehow death can't really get a firm grasp on me, and I am still here. I ain't going out without a fight, baby.
I see people get hit in the head all the time. The biggest things we always worry about is if there's any laceration, fracture, or internal bleeding inside of the skull. When we're concerned about that, we'll end up getting a CT scan of your head just to make sure there's actually no bleeding in there.
Starting to feel a little gurgly. My bowels were making a movement, and I figured I probably ate something bad and went to the bathroom to relieve myself.
Ah, super common. So people will come in, gurgly, my stomach's moving, there's gas moving around, there's poop moving around. Go to the bathroom.
I have to go to the bathroom.
Most of the time people will have some relief thereafter. And you should actually look at your poop. Make sure that there's no blood in the toilet, make sure it's a normal color. Certain things will help.
After going to the bathroom, I felt much better. Ooh, free food. And I went back to the original plan, having delicious and free. Oh, it's back. I was feeling really nasty again, and it was stronger this time.
He's eating food. It's probably not causing the food poisoning potentially. Anywhere from a couple hours to a day, food poisoning will kick in. So it doesn't typically happen right away.
As the seminar went on, I started to get more and more sick.
Yep.
And looked more and more pale. I would draw that here, but you know.
In these situations, hold off drinking a lot of fluids unless you can tolerate it, because that can then make you vomit and become more dehydrated. Get home, chillax, lay down. When you get that signal to go to the bathroom, go to the bathroom. We don't want anybody pooping their pants.
Halfway through the walk home, I was starting to feel really nauseous again, though. Then I saw a truck driving my way, and I thought it would be really embarrassing to be seen throwing up on the side of the road at like 8 in the morning. So I just willed myself to not throw up.
I see the opposite. I see people that come in who have these cyclic vomiting type syndromes. We see them sticking their fingers down their throat in the emergency department. Don't do that. We have medications to help.
I don't know how. Later, my roommate was talking to his then girlfriend, and she was like, that sounds a lot like appendicitis. You should take him to the hospital.
Appendicitis is inflammation and infection of your appendix. And if you do have appendicitis, typically we do a surgery here in the United States to remove it. If you're having abdominal pain, nausea, vomiting, fevers, there could be a virus, but you need to get checked out. If you're having a significant amount of abdominal pain that's localized to an area.
At the hospital, I'm asked a bunch of questions. Where does it hurt? How long has it been hurting? When did this start? Etc., etc.
We ask lots of questions on a scale of 1 to 10, 10 being the worst, what is your pain? And then doing a physical exam will then allow us to do the labs, any imaging that we need, kind of go from there.
And then the doctor told me, I think you have appendicitis. We're gonna have to move you to urgent care. What's appendicitis? It's the infection and inflammation of the appendix.
The reason why you're having pain from the appendicitis is the inflammation. The appendix gets infected, your appendix starts swelling, and the swelling and the inflammation goes to the surrounding tissues. Every time your intestines move, it goes over that area, it causes pain.
Failing to treat it can result in rupturing and infecting your entire body, which is usually fatal.
Yes, not usually fatal, but increase the risk of fatality.
Fatality.
Basically, if your appendix breaks, it bursts open and then poop is leaking into your abdomen.
What's an appendix? It's a useless thin tube in your lower right abdomen. It serves no function of the human body.
Yes, it is a useless little dinky thing that looks like the size of your own pinky, just sitting there in the right lower quadrant. It's not really used for anything. It's like kind of a remnant anatomy from evolution, basically.
Yeah, so I was going through mountains of pain and suffering because this little tiny part of me that has no purpose was going haywire and could literally explode inside of me and kill me.
I get so many patients that come in that say, I'm gonna explode, I don't want to explode. Usually they get the appendix out before it explodes. Actually, sometimes people feel relief after it perforates, which is the word that we use instead of exploding.
I was bitter, but I had no other choice. They admitted me to the hospital for emergency surgery.
Emergency surgery could be emergency that second, or it could be emergency the next morning. We'll put you on antibiotics, we'll keep you NPO, which is nothing by mouth, give you IV fluids so you stay hydrated, and obviously treat you with anti-nausea medicine and pain medication.
This was not the plan. In the hospital, they take me to the scanner room.
It looks a little too deep to be a CT scan. It looks more like an MRI. You only use an MRI actually for pregnant individuals because there's no radiation exposure. Majority of the time we use a CT scan.
They needed to look inside of my sweet bod to assess the situation and to see how dire it was. I didn't know how they figured this one out, but I guess that I was too thin and that made the scanning more complex.
So if you're actually really, really skinny, all the organs are sitting right next to each other with minimal fat in between. And so it's really hard to distinguish the different organs that are sitting right there. Somebody who's super skinny, you probably want to use IV and oral contrast to light up the different organs that are in the abdomen.
After the scanning room, I was back in the hospital bed waiting for the next steps when I got a visit from the anesthesiologist.
The anesthesiologist is the doctor that takes care of your sedation and your breathing when you're under. And they'll keep you sedated, typically with anesthetic gases. They're there to monitor you and make sure that you're fine and safe.
He and the surgeon were talking, and I heard them say they needed to pump my stomach for safety. John then turns to me and says, with some kind of twisted joy, "Oh, you're not gonna like this."
These orders are all kind of weird. Normally what happens, you come to the emergency department, you check in, you're evaluated by your nurse, and you're evaluated by the physician. You say, oh, okay, this is the differential diagnosis. This is what it could be. You do blood work and imaging. Get your diagnosis if you have one, then you'll be whisked off either to the operating room or to your inpatient bed.
To pump the stomach, you have to have a tube pushed down your throat. It's a long piece of plastic that you have to continuously swallow down until it reaches your stomach, and then they can turn it on and get all of the stuff out of your stomach. I don't think you need any convincing when I say that is terrible.
The procedure does suck, and most of the time the patients who have it in feel significantly better once we're able to suck out whatever contents in the stomach that there are that need to be decompressed.
Also, you can do it wrong. If you don't position your head correctly, it can hit the back of your throat and make yourself vomit. And guess what I did? I threw up everywhere. On myself, on the nurses, on the surgeon who was trying to help me with the tube. What if I don't make it through this? Will I ever see you again?
So if you go through the nose, it actually decreases the gag reflex. One of the major reasons why we actually go through the nose if you're awake.
Finally, I was rolled off to surgery and moved to the operating table. Oops, one more touch to the back of the throat for good measure.
Don't understand exactly why he needs this during his appendix surgery, unless he's super dilated and it's causing an obstruction.
And then I woke up. Appendixless. I was cured.
So what ends up happening is you wake up from surgery and you're like, holy cow, it's already done.
Where am I?
You're given medications basically that do cause amnesia, sedate you, and you lose track of time.
I spent the next day healing a little bit. My mom visited. I watched cartoons on TV all day, and I got soup and an icy pop and juice for meals, which seemed like a lot of sugar for a hospital to give someone, but hey, this is America, baby. Sugar is like our aspirin, and I didn't mind. I just went through a lot.
Yes, you need to be able to eat after surgery. Usually we give sugar-free Jell-O. Typically you need to be able to poop and pee after surgery. Get up, walk around, make sure you're okay.
I don't know if you could tell from my voice right now, but I'm pretty sick. A vile harbinger of disease. Don't worry, it's not COVID. Everything's fine. Being sick has made me think about a lot of things, like what it's like to breathe.
You can have influenza, you can have RSV. There's lots of different viruses out there that can cause an upper respiratory infection, which is like runny nose, cough, congestion.
I remember when being sick used to be awesome. You would get sick, go to the nurse's office, parents would pick you up, your mom will make you soup, and you get to watch cartoons or something for the rest of the day.
I totally remember when I was a kid and I would get sick and you'd go to the nurse's office, and if you were sick enough or if you had fevers or you didn't look well, they'd call your parents would come pick you up and take you home and set you up on the couch with blankets or in your bed and potentially where your TV is, definitely watch cartoons. So I could totally relate to everything that he is discussing right now.
Now, at least for me, getting sick is like, well, I have to work and be sick. Who set up this is a scam. The world should not be this way.
A lot of jobs, even my own first jobs that I had before I went to medical school, you do get sick days. But most people use those sick days to actually be saved for vacation. If you're in a position where you have to be at work, you wear a mask, you can say, I'm not feeling well, but I need to be here, but at least you're protecting everybody from your big sneezes and your big particles, so to speak.
There should be a service that's like, when you're sick, somebody comes over and they make you soup and they tuck you in and give you a little kiss on the head. They put on a movie and say, you cozy? You go, yeah, I'm cozy.
They kind of have this service for elderly population when you actually have like home nursing or somebody who's set up to come to the house. Typically you have to be sick enough that you cannot perform, say, your ADLs, which are activities of daily living.
The worst time that I've ever gotten sick was probably appendicitis. I already made a video about that though.
Yes, appendicitis, infection of your appendix down in your right lower quadrant of your abdomen. Starts off as benign discomfort of your abdomen, typically around your belly button, and then slowly will make its way over to the right lower quadrant. You'll get fevers, you can get nausea, you can get vomiting, you can get diarrhea, and anytime your body shakes or moves or goes over a bump, it hurts. Typically, you'll have surgery to remove your appendix.
The other more recent bad time that I got sick was about a year ago now, when I was starting to feel very tingly in my appendages. And I'm like, that's probably the worst thing possible. Let's Google everything.
It's the worst thing possible.
I knew it!
So that could be an electrolyte abnormality, which could be a few different ones. It could be dehydration, it could be anemia, it could be thyroid. There's a lot of different things that it could be. When it comes to what we call paresthesias, or tingling of your extremities, we try to do a big, broad examination of different lab or ancillary tests that we can do to try to start narrowing down what's going on.
And then the next doctor that I see was like, I don't know. And I'm like, okay. And they're like, well, let's recommend you to a neurologist.
Recommending to a neurologist because a neurologist has to do with like your brain and your nerves.
Because it could be a problem with your brain. And then I go to that doctor and they're like, well, I don't know what it is either. But we should scan your skull and spine.
CT scan of the head to rule out any weird growths, abnormalities. If you can check to see if there was previous strokes, make sure there's no bleeding. And then they want to check his spine just to make sure that there's no other abnormality related to like lesions.
And I'm like, well, why don't we just start with that? It's been weeks of these symptoms.
So one is it's been weeks with these symptoms. So one, we know it's slow and that it's not progressing quickly, which is good. But it's also that they're still persistent, which is a little bit of a worry.
And I'm just sitting here, why don't we start with that? And so she's like, good news, we're not scanning a ton of people right now. We might be able to get you in today. I'm like, oh, this is good. She leaves for a little bit. She comes back. She's like, oh, I'm sorry. I totally forgot. We have to. And then she said some word that I totally can't remember, but it's the process.
Prior authorization means as a outpatient, when you're trying to get imaging or advanced imaging ordered, sometimes you have to have a justification to the reason why you're getting the images and have to be sent to the insurance company, so then the insurance company can then approve it, and that can take a while too.
I get approved, and so we move on. So I'm ready to get a scan for my skull and spine. It's inside of an MRI machine.
If they're going to scan somebody's spine, typically they're going to do an MRI. The only time we typically use a CT scan for your spine is actually looking for traumatic injury to the bones of your spine and maybe to see if there's any compression of the spinal cord. But a better image is an MRI.
Like, are you claustrophobic? Maybe a little bit.
Yeah.
I guess we'll figure out while I'm in there.
So an MRI is basically a tube, and it's literally like a couple inches away from your face if you're actually going through it. And you're in there for a relatively long time, and it makes really loud noises.
They're like, okay, cool. This is going to take about 1 hour. And that made me a little nervous because I'm a really restless person. At all times, I have to be moving.
If you're moving, how can it actually put moving images in a static form? It can't. You need to stay very still, and it's very uncomfortable.
They give you like these little headphones, and then they're like, do you like classical music or jazz music? And I'm like, oh, let's do jazz music. And then you go into the tube, and it's really, really tight, and it's kind of freaky. But the jazz music actually helps a little bit.
You got to close your eyes, because if you're trying to like look up, you're gonna get claustrophobic, you're gonna get nauseous. It's not gonna be good.
I did surprisingly well. We got all the scans done. We only needed to redo one of them because I kind of twitched my head at one point after I was suppressing for so long. And I come out, they say, okay, we're gonna look at these, we're gonna see what's up, and then we're gonna tell you. I'm actually like really freaked out because at this point we're thinking, oh, a brain scan, the thing that's the most delicate part of your body, and they have to look at it and see if something's wrong with that. That's kind of freaky.
You know, maybe you can move your toes a little bit because you're not getting those imaged. Maybe you can move your fingers a little bit, as long as you're not moving the major structures that they're looking at.
So we wait, and then the results come back. The results were brain scan, unremarkable.
Your brain is a remarkable thing, but when it comes to looking for disease, when something says unremarkable, just identifies it. There's nothing that is abnormal.
Okay, I think technically I understand that that's a good thing. You didn't have to say it like that. Spine scan, also unremarkable. I came up clean. So what the heck is wrong with me? Turns out we never found out. I spent thousands and thousands upon dollars waiting, ultimately to amount to, I don't know what it is. And then eventually the symptoms went away. Great. What's the moral of the story here? I don't know. Thanks for watching.
And this happens so much in medicine. Sometimes you can't find the abnormality that is there. it doesn't mean that there isn't an abnormality there. There's just something that we can't find that is obvious. One, you always have to look at hydration status and what you're eating. Those two things are very big. What environments are you in? Are you in a weird area where there could be heavy metals or weird parasites or a lot of things that we wouldn't necessarily test for?
Yeah, your scalpels.
Scalpels.
Over on the right.
Yes.
You pick those up with just your forefinger and your thumb.
Okay.
Very delicate.
There are different ways to stabilize a scalpel. You definitely want to pinch it basically and then have it on the palm, or you can go one above or one below to stabilize it as well. So there are the appropriate techniques.
Very delicate. Not telling you to now. Put
right.
down. Put down the scalpel, sir. Put it down.
I think we need it.
We got what looks like to be feet and then just random open intestines just laying there. Skin's already off and they've already used the scalpel. Typically, you're not going to use the scalpel for anything else. Your scalpel in the operating room is to make the first incision on the skin and then that's it.
Put it down.
Okay, dropping it.
Oh man, okay, so sometimes it does happen where you actually drop medical instruments inside the abdominal cavity when you're doing surgeries, and you may or may not be able to find it.
Excuse me?
So they actually do an x-ray to check to see where it is. And this, you hear the monitor in the background going with the asystolic sound of like. This would really only happen if this scalpel sliced the aorta as it's running through the abdomen and you're bleeding out that fast. So typically not, but that's actually really funny.
Well, come, do you know how to
get the spoon?
Oh, I dropped the spoon.
I don't know why they need a spoon. Spoon! And I wonder why a scalpel stuck so intensely in the abdomen as well.
Oh my god, that was the only tool we could use to scoop it out!
I got it.
Oh god!
I got it.
He put his hands inside the abdominal cavity. Actually, that happens all the time. You're in a sterile gown, you have sterile gloves on, but you use your hands because of the dexterity of being able to feel the tissue. You're not as rough, it's more of a blunt object versus something that is sharp.
Wait, shut up. There's another spoon. There's another spoon. Oh my god.
Blood, when it starts to dry, gets actually really, really sticky.
Is it sticky?
So unlikely that something would slip out of your hands. You'd actually have more control over it.
Oh god.
Has anybody had muscle twitching when you're getting stressed out or annoyed? You actually can have some twitching of your eyelids.
Look at my eye twitching.
It does actually occur. It just has to do with the muscle contractions and nerve firing.
I'm just gonna grab one of these needles here and jab it right into the patient's face.
Doctor, I think you're supposed to be operating on the heart.
Shut up, nurse!
If I, as a physician, ever yelled at a nurse that way, I would lose my job and I wouldn't get anything done. The nurses pretty much run the show. They're a lot more hands-on than the doctors are.
All right, we're doing pretty good. If by pretty good, I mean pretty badly. What have I got? I don't even know what I got. There we go. Ripped a rib out.
What? They're not taking ribs out. I think that was probably an accident. Ribs are small. They kind of are about a C-type shape. I know people get them removed for cosmetic purposes. Typically, there's not a reason to have a rib removed.
Just like I'm supposed to. Just like Daddy taught me. Daddy, he never thought that I could be a doctor.
Why does his dad look like the Monopoly man, but with hair?
You must be the Monopoly guy.
I just ripped out his lung. Don't think I won't do the same to you.
The lung is bigger, it's spongy, multiple different colors depending on the damage that might be done to the lung if you smoke or not smoke. You should definitely Google a lung of a smoker. Anatomy-wise, it actually looks quite interesting.
Ah! Come on, Bob! Cooperate with me, Bob! Cooperate with me!
Sometimes you actually do see some breakdowns of surgeons in the operating room. Very infrequently does anybody lose their proverbial poop.
So it's freshman year. I wanted to do like an activity. What I tried to do was parkour.
Parkour!
It was like supposed to be a quote-unquote beginner parkour thing.
Okay.
We were jumping around the 4th level of the parking garage. Time to drop from the 2nd story and do a sweet tuck and roll into this little grass patch.
Yeah, don't do that. Tuck and roll. So I've always told people, if you're falling, you need to hit and then roll. You can displace the energy.
I drop. And I landed from the 2nd story straight onto
Straight onto his Ow! We see a lot of people who have injuries where they fracture their coccyx bone, which is your tailbone, causing a lot of pain.
I felt something pop weirdly no pain.
That's not good. You hear popping noises. It could be a fracture. It could be a dislocation. Could also be a rupture of some tendons or ligaments. And also disc herniations could make you feel a pop, which then because you feel it, you think that you hear it, but it's actually internal.
And then the guy behind me is about to go. And he drops. And instead of falling on his he fell on his face.
Oh no.
Like his legs hit, he went forward, he did not roll.
Oh my gosh. So fall down, hit your head, snap your neck. You can definitely cause vertebral fractures, intracranial bleeding, skull fractures.
So, you know, after a while, we're just standing there, we're looking at this guy dying on the ground, and we're like, oh, what do we do? What do we do?
If you're actually around somebody that has this type of injury, please call 911. Stabilize them, don't roll them around, don't move them, and get them to the hospital ASAP.
Like straight up, his ribs are broken.
Oh my gosh, broken ribs are the worst. It's not like you can splint them. So every time you take a deep breath, you're causing pain. You're moving the broken pieces of the rib fracture.
So I drop and I'm like, forward, forward, forward. I saw them roll on like their shoulder. And so my legs hit the ground. I go forward and I put 100% of my weight right onto my shoulder.
Oh man. Our bodies are made to bend a little. You use your own spring action so you can land, you can press a little bit, and then you roll, but it landed right on the shoulder. Fracture versus dislocation versus fracture of the clavicle. These are my thoughts.
I'm a doctor. I know what's best.
Holy syringe. What? Holy cow. The syringe had like holes to hold it. We don't actually use those very often in the emergency department. Those are typically seen at like the dentist's office, and they typically re-sterilize them so they're clean for the next person.
So this time I need to be very careful in my excision of the sternal cavity. So let's take
oh my gosh. It doesn't rip that easy. You know, you have a lot of muscles attaching it. When a cardiothoracic surgeon is in there doing surgery on the heart, they are super delicate, very good, and they have to deal with very fine movements.
This expert precision.
Nice. I love the random cow.
Watch game off!
Oh my gosh. We do use different types of medical saws in the hospital, but not a chainsaw. I've seen lots of chainsaw injuries where people hit themselves, they get their hair caught in it, they hit their head. It definitely messes up the tissue.
Grab the lung and rip it out of there. No need for that. No need for the other lung.
Oh, there you go. So super good. He actually grabbed both lungs.
Oh, we need to hurry up here. We don't have much time. It's okay. Shh, Bob. It's okay. I gotcha. I gotcha. I gotcha.
We do have moments where may straddle up on top of the patient. Say you need to be doing CPR and they're moving. Sometimes it's easier to be on the gurney or the hospital bed at the same time.
Okay. All right. Try again. Take a second mulligan on that.
Work it. How's it going, bro? My name is PewDiePie. We're gonna do the kidney transplant, yes. I read your bro's comments, and I think we're ready for this, aren't we, Bob? You're in my domain now,
Oh my gosh. Any surgeon actually going to the operating room likes to have it serious but lighthearted. There's sometimes music playing in the background. You wouldn't have the abdomen totally open, but obviously this is just a show. Kidney transplants having to do with the fact that somebody's kidneys are not functioning. They'll probably be on dialysis.
So a lot of bros said that you don't want me as your surgeon. Don't make me slap you again. Don't make me slap you. I don't really get what you mean by that. Nah, don't fight me, lightsaber. Oh, sorry about that, Bobby. Burn his nipples a little bit.
Doctors have been caught on camera being unprofessional, and then they can actually lose their job, lose their license. And obviously this urologist would not be using one of those mirrored lights on the forehead. They do not need that.
Nice and easy. There we go. Oh, shit. Sorry about that, Bobby Boo. Where did the laser go? No! Ah! Hey, ow, ow, ow! Not on me. Ah, Bob, calm down. Off with the laser. Off with the laser.
If you take your finger off the button, they typically will stop. They just don't fly around like that, and they have like automatic shut-off switches.
Drill, did I tell you to start dancing? No, I did not. Let's grab this little thing.
He just literally grabbed the large intestine. You don't want to just grab that and throw that out. The large intestine starts at the right lower quadrant, goes up, transverse colon all the way over, then goes down into rectum and out.
Oh, I love your new scarf, Bob. Oh.
If it does need to be removed, it's probably put in a biohazard bag. People always ask, can you get organs, limbs back? And the answer is probably yes. You just have to talk to the hospital and figure out the legality component of it.
Holy shit! What the?
Got a bleeder. Got a bleeder. What's happening?
I don't want to be a doctor anymore. Nope. Oh, don't you dare fight me!
When I was a resident, been in situations where the surgeon accidentally not expecting a vessel to be where it was, and the vessel gets nicked. Easy, control the bleeding, fix it, sew it back up. Doctors typically won't run away when the patient is dying.
Oh, yeah! That's right, I'm the boss of you. Oh, okay.
I've seen people throw tools or get frustrated or throw things on the ground because they're humans, but not organs.
Oh, okay, okay. We can actually do this. Oh my god. Oh, don't you dare bleed on me, Bob. I will kill you if you die. Oh, it's a perfect match. That will make us a perfect match. We're like, nothing. Oh, high five. That was awesome. Surgery complete. Looks fine to me. I'm sure it'll live.
It looks like he's got kidneys in the hand. You have 2 of them. They sit in the retroperitoneal space. You can live with just 1. If they're not functioning, they can stay inside your body, but you need to have dialysis to clear out your blood because it's a filter system to keep certain electrolytes and get rid of other toxins, that sort of thing.
How you doing, Bob? How you doing? It's all gonna be good. You're in safe hands. Dr. Pouts is in the house?
Yeah, that's the phrase. Doctor's in the house. You wouldn't be rubbing the patient's face, would have a mask on, would have hair coverings. Anesthesiologist or the nurse anesthetist will be taking care of the airway as well as the anesthesia for the procedure.
Alright, Bob, you may feel a slight pain in your chest area. Don't worry, it's normal. And if your balls tickle, that's normal too.
No, it would not be normal for doing a chest procedure and having any indication that your testicles would be tingling or uncomfortable. If you're having a heart surgery, the biggest thing you have to deal with is the cage, right? You have the rib cage, you have the sternum, you gotta get through that. So typically they're using a saw to cut through your sternum to open it up.
3. 1, 2, 3! Oh, whoa, whoa, whoa. Whoa. That's how we do it in Pitapatam.
That's definitely not how it's done. Sometimes a hammer is used, but you're actually hammering into another tool. You're not using it directly on the bones and shattering the bones. You're never going to get those back into place.
What the f are you? The f are you? Is that his liver? They're cuddling.
The chest cavity and the abdominal cavity is separated by your diaphragm. And yes, your liver in your right upper quadrant is just underneath the ribs there.
High five. No? You don't make me slap you. I do believe this is how you hold the scissor. That's how they teach you in school, isn't it? Alright, Bob.
Actually, no. A lot of scissors actually have like extra places for your finger, like an extra finger, so you have better dexterity. But no, there's actually a specific way. And a lot of times you actually put your index finger really close to where it pivots, so you have a lot more control.
It's gonna Are you okay there?
I've dropped tools on the ground before. You just leave them. There's, redundancy of tools. You can actually use something else in case they drop to the floor. But now they're not sterile, so you can't use them.
Come on, baby.
Oh, and just throw away all the intestines. Okay.
All right, let's get the stomach out. There you go.
At least now we got some more realistic, some blood on his hand, even though it's a non-gloved hand and he's actually not scrubbed in. He's just wearing scrubs.
YOLO mode. Get that there. It's in. It's in. It's in.
Wow, look at the cavity, the hole basically of the patient. It's actually filled with blood, and a lot of times now that blood is starting to coagulate. You got to get that out so you can see what you're doing.
It's in, I tell you. It's in. What do you want from me? Calm down.
Wow. Yep, lost too much blood. Obviously, no heart there, so the patient dies. Brain transplant.
Wait, before I do anything, you see how it says Bob there?
It's actually good, but you need to identify the patient, make sure you have the right patient, right surgery. So Bob's head is shaved, ready to go for the surgery, which is quite common.
What? There's a tomahawk. Okay.
There's no tomahawks. Typically, these type of procedures, you're probably gonna have a very skilled saw.
You might feel a little headache, Bob, but that's normal. Tomahawk chop!
This is not what occurs in the operating room when you're under anesthesia and you don't know what's happening. The doctor will literally go over what they're going to do and explain to you the different steps.
Oh, no way. There's a brain in there. Oh, man. This. Oh, done.
Look how small the brain is. You don't just smash into someone's brain. Obviously, you need to take the current brain out. And there's a lot of blood vessels and connectivity to it. No, it's called bedside manner. It's called composure, keeping what you're feeling in.
You better hurry up. Give me the drill.
And if you're bleeding that much too, you must have hit a major blood vessel.
Ah, I'm a professional. I can't work with this.
Patient's gonna die and bleed out.
Ah.
Yep, when you're just bleeding out, you can't just let it bleed while you're looking for something else. You need to have somebody either control the bleeding, you know, hold it there while you're doing whatever you're doing, or vice versa.
Come on, baby. Ah. Bob. Disco time. What the?
I've seen people come in who've gotten hit in the head with hammers and different objects. You know, it hurts, right? But the brain tissue itself is insensate. It does not have actually pain receptors to it.
You're gonna be so smart after this.
It's very intricate to reattach. They don't have the ability to do that currently. Taking things apart is probably easier.